Good morning and welcome to the Thursday, May 19th special meeting of the Housing and Community Development Council Committee. And this morning, the City Council meetings have been reopened to the public in person effective July 20th, 2021. Face coverings are required for members of the public who enter city building regardless of vaccination status. Is that still true? No, that's not still true. But I am wearing them just because I want to be careful. The City Council committee members will be participating from the council chamber. Members of the public are invited to attend and participate at the location identified on the agenda. As a courtesy and technology permitting, members of the public may continue to provide live remote oral public comment via the city's Zoom video conferencing platform. However, the city cannot guarantee that the public's access to teleconferencing technology will be uninterrupted, and technical difficulties may and have occurred from time to time. Members of the public desiring to provide comments as part of the meeting are encouraged either to submit written comments at least 2 hours prior to the meeting or to attend the meeting in person. And so now I will give you the webinar ID for the Zoom. It is 893-9033-7746 with the passcode 448432. And I will call this meeting to order. Roll call.
Cindy Silva.
Cindy Darling, we're both here. So we're ready to go. Approval of the minutes.
Move approval of the January 31, 2022 meeting minutes of this committee.
Thank you, and I'll approve those also. Consider those approved.
Wait, I'm sorry, I need to correct myself. I was reading the minutes and I just basically made a motion to approve the minutes from the previous meeting. I move
Oops,
to...
you gotta turn your mic on.
Good. I move to approve the February 15th, 2022 minutes of the Special Committee of the Housing and Community Development.
And I'll second that. We'll consider those approved. So now we come to public comment. And under California law, public comments at special meetings like this one are limited to subjects on the agenda only. Therefore, public comment will take place during the committee consideration of the item, which brings us to our consideration item, which is the FY 22-23 CBDG, CSG, HSG, and PLHA grant application. So I assume we are starting with a presentation?
Correct. Thank you, Councilmember Darling. Hi, everyone. My name is Shalona Vian, Affordable Housing and Grants Coordinator. I will help facilitate the meeting today. I also have Meredith Calbreth on my left, who will also help with the logistics and act as the Zoom administrator. So the Housing and Community Development Committee will conduct a public hearing to consider applications submitted for grants under the Community Development Block Grant Program, Community Services Grant, Homeless Services Grant, and Permanent Local Housing Allocation Programs for fiscal year 2022-2023. Each applicant will be allowed up to 3 minutes to provide a summary overview of their project and explain why they believe it is important for the city to fund it. The committee will then have the opportunity to ask questions about each application. In light of COVID-19, the city has extended the courtesy for presenters to present either in person or over Zoom. When your organization's name is called, please press the raise your hand button on Zoom or step up to the stand. The first presenter we have today is for the Infrastructure, Public Facilities, and Housing Activities category. We have Habitat for Humanity for their home rehabilitation loan and emergency grant program.
Hello, are you able to hear me?
Yes, we can.
Great,
Okay, I
Give
will
me 1
start
second.
the clock for 3 minutes.
great. All right, good morning, everyone. My name is Laura Salcido. I'm the Resource Development Manager for the Home Preservation Department at Habitat for Humanity East Bay, Silicon Valley. Our department currently administers the City of Walnut Creek's Home Rehabilitation and Emergency Repair Program, and we have been doing so for about 3 years so far. For this next funding cycle, fiscal years 2023 through 25, we are requesting $120,000 to continue supporting this program. The program itself is, excuse me, is a program that helps low-income homeowners do important and necessary health and safety repairs where they live so that they can continue remaining in their homes for the foreseeable future. Based on our experience serving this jurisdiction and its constituents, we believe that this amount will likely serve about 4 households. Our estimate is that it will be, 3 grant recipients around $15,000 each, and a loan recipient closer to maybe $56,000. Of course, we don't know the exact amounts for the projects because it depends on the actual needs that our inspectors see once they tour the homes themselves. Typically, fewer applicants are in need of the loans, which are reserved for bigger ticket home improvements. They can be up to $65,000. These loans are very special, especially to these low-income communities, because they are affordable loans, not just because of the 1% simple interest rate, but because depending on the applicant's financial need, they can be set up as deferred, requiring no payments for the term of the loan unless the home is sold or transferred. We tend to serve quite a lot of older adults, seniors, retired folks on a fixed income, and these programs are often the only way that they can address their needs in their home. And especially when it comes to things like loans, most other financial institutions do not provide services to them. The common uses for the program, for the loans, like I said, which are larger projects, they tend to be things like re-roofing, sewer line replacement, termite and dry rot repair, furnace installation, all kinds of things like that. But of course, we'll do those type of projects for grants too if they can fit within the budgets. So for this current fiscal year, we have completed 2 projects so far, and we have 2 under construction, and we have 6 applicants in the pipeline. So we really hope that you will continue to support the program for the next year. Thank you.
Thank you. Mayor Pro Tem Silva has a question.
Thank you very much for the quick presentation. I know this program offers a great service to older adults and those on fixed incomes. Can you explain the $120,000? It's described as your role as a program administrator, but I assume that part of the funds are actually being used to fund these improvements?
Oh, definitely. Yes.
thank you.
So let's see. It will be around 75 plus 56,000 that we are dedicating directly to the improvements in the homes.
Which is more than 120,000, but.
Yeah, I'm so sorry. I think
so your
I might have.
administrative costs are minor in comparison to actually putting the
Yes.
funds into the improvements of the homes. That's my question. Thank you so much.
Sure, thank you.
And I just have one quick question. I know that a number of utilities like MCE and East Bay Mud and Contra Costa have programs. Do you guys ever coordinate with any of the utilities to look and see if they can bring money in on top of what you're doing for energy efficiency, water use efficiency type measures?
In the past, we have reached out to them. I think we haven't found a case where that has actually happened yet,
Okay.
but I'd like to revisit that this coming year. We also did something kind of cool this past year, which I think we'd like to do again, which was we kind of cross-promoted through a mailer that went out through the utility bills themselves.
Okay, thank you.
Mm-hmm.
Thank you, Laura. Okay, next up we have Meals on Wheels Diablo Region for the Energy, Safety, and Health Improvements to Walnut Creek office. Okay, Caitlin, I have 3 minutes on the clock.
Great, thank you. Can you all hear me?
Yes, we can.
Okay, wonderful. So I'm Caitlin Sly. I'm with Meals on Wheels Diablo Region, and
You went mute, Caitlin. Can you check your video or your? Caitlin, we can't hear you right now. Can you hear us?
Hey, Caitlin, we actually can't hear you. Yeah, we can't hear you. Yeah. I'll restart the clock for her. We're trying to bring Caitlin back in for the energy safety and health improvements to Walnut Creek office.
Can you all hear me?
Yes, we
Yes.
can now.
Okay, sorry about that. No, that's okay. So I'm not sure where I left off.
We heard
Um,
nothing.
Oh, okay. Well, that's good. Then I'll just start from the top. My apologies. So we are actually putting in a proposal for upgrading our HVAC system at our Walnut Creek office. And the reason for that is a two-part. One is that we wanted to install HEPA filters during the COVID-19 pandemic and still would like to be able to do that to keep the air healthy and free of germs. But when we looked at doing that, we found out that our HVAC system is too old for that. And if we were to install HEPA filters, the entire thing could break. So we would like to do that both from a health perspective with COVID-19, but also with the ongoing wildfires that we continue to experience. Right now in our office, if there is a wildfire, we shut off all the air conditioning, which you can imagine is very hot during the summer. So we would really like to upgrade our HVAC system for the health of our employees and our clients and our volunteers that are in the building. And we put in our proposal. We know that with inflation, the costs have already gone up quite a bit. And we think it would be really helpful for us to be able to continue to deliver services in Walnut Creek, to have a healthy and clean air in our office. So we really appreciate you all considering this.
Thank you. Did you have any questions, Mayor Pro Tem?
Thank you for coming back on so we could hear you.
Sorry about that.
No, and Meals on Wheels provides a very needed service in the community, so thank you for that. Is the building at on Mount Diablo, on Civic Drive, is that Meals on Wheels building? Do you own the building?
We do. We own it outright. We actually just paid off the last of our mortgage. So
Congratulations.
thank you.
I noticed that there's one quote that's presented. Do you have multiple quotes for the work?
We don't at this time, but we will get multiple quotes before we actually execute the project.
I think that would be important because you're
Yes.
asking for public money. And
Absolutely.
if we were doing the work for you, we would have to do that. And this is a question for staff, but maybe you know the answer. Because federal dollars will be involved in this, will it trigger any labor or wage requirements that you're aware of?
Yes, if there is over $5,000 in federal funds, then it would trigger Davis-Bacon, so federal labor standards
Great,
requirements.
thank you. And that's reflected in these dollars?
Yes, and we will also, we got this quote for the purposes of the proposal, but we definitely will get more quotes before completing the work and ensure that they comply with the wage requirements.
Okay, thank you.
And that covered my question too. So I was just worrying about inflation, and the cost of HVAC units has gone through the roof. So, all right, thank you.
All right, Caitlin, stay there for us, because the next category is for public services, senior services. So Meals on Wheels is also applying for the care management program. So we'll have 3 minutes on the clock for you.
Sure. So you guys are going to have quite enough of me by the end of this. So for our care management is probably the part of our service at Meals on Wheels Diablo region that people know the least about, but is one of the most important services that we provide. Many folks are familiar with our name, Meals on Wheels. As it says, we deliver home delivered meals to low income and homebound seniors. But what most people don't know about us is that we really provide more than a meal, and that we have an array of supportive services like exercise classes and friendly visiting, companionship services, and many others that really support the total health of the seniors that we serve. And one really important piece of that is care management. So the way I think of care management is all of the other programs that we have, if they don't meet the need of the seniors that we serve, care management is there to step in. So they deal with the most complicated cases, such as seniors that are being evicted or are dealing with depression. We can refer to counseling services. So it's really comprehensive case management that we are able to provide for seniors in our community that need that extra help in either applying for other public benefits or referrals to other agencies, or any other needs that they have. We also have a small emergency fund, so we're able to help people with a one-time payment of their PG&E bill or their water bill or whatever is preventing them from being able to afford basic needs. Like a lot of times we have people calling us trying to choose between paying their bill or paying for their medicine, and we don't believe that any senior should ever have to make that choice. Another really unique part of care management is our elder abuse prevention program, and that is a partnership across the county with the DA's office, Adult Protective Services, the Family Justice Center, Contra Costa Senior Legal Services, Empowered Aging, and many other partners that help investigate and mitigate cases of elder abuse. So we provide the case management services for that and regularly receive referrals from Adult Protective Services and the other partners where we're able to go into the home and help seniors who may be dealing with either suspected elder abuse or something more serious. And we're able to connect them to the partners that can help them remediate that. So it's a very complex service, but really important for the seniors we serve. So we appreciate your consideration.
Thank you. Mayor Pro Tem?
Thank you for providing this information. I've known about these services in the past, but they are often as you said, the little known, but most important that you probably provide in terms of beyond just the basic meals 5 days a week. Do you find that most of the clients that you serve in this arena were originally your Meals on Wheels food delivery clients, or do you find that you're also, the point of entry is primarily where? I'll ask it that way.
Yeah, that's a great question. I think it's both. And we do get a lot of internal referrals from our other programs, from Meals on Wheels, definitely, but also from our fall prevention program, in our Friendly Visitors program, anywhere where we have people going into the home and they can kind of see what's going on. But we also get a lot of referrals from outside, from hospitals. We get referrals from family members, people that call in themselves. So I would say it's a good mix of both internal to the organization, but also from other community-based partners.
Thank you.
Thank you, Caitlin. And my question is more of what you're seeing as far as a trend on eviction. I know the Homeless Task Force, we have talked about the potential for increasing evictions, increasing the number of seniors going into the homeless. And I was wondering what you guys are seeing as far as that need in this program.
We are seeing a huge need for housing assistance. I think as seniors are on fixed incomes and yet the prices for housing continue to increase, that continues to be a struggle, and I think only got worse during COVID. So we do see that as an issue. Luckily, we are able to occasionally help with one-time help, but I think that's one of the things that our staff struggle the most with is seniors that call in needing help with housing resources, and there's just not a lot of places to refer them. So that continues to be a struggle.
Thank you. Any other questions? Okay, we'll turn the page and you can go on to the next one.
All right, Caitlin, this one is for the Meals on Wheels program itself, and then we have 3 minutes on the clock.
Great, thank you. So this is the program that folks are probably most familiar with. That is our home delivered meals program. And that is for anyone 60 and older who is not able to get out and get food for themselves. And they may not have a caretaker who is able to prepare meals for them. So these are what we really call the hidden hungry. They're folks that are in our communities that are probably our neighbors. And it's that house on the block that you just don't see anyone ever come out of. And so these are folks that are really isolated. They've gotten even more isolated with the pandemic and with staying at home. They were staying at home anyway, but to have fewer people coming and visiting them. So it's been really important to be able to provide that daily nutrition. During COVID-19, we used to deliver each day, and now we're going to a weekly delivery of 7 frozen meals a week. And that actually has been something that our clients seem to prefer. So we're doing client surveys to gauge kind of what people would like to do, continuing with that. But we really believe that nutrition and really the daily check-in is also important. So oftentimes the volunteer that delivers the meals is the only person that our seniors are seeing each week. And so they are able to report back on changes they see. If the client is not doing as well, reports that they fell, reports that they're not eating, those kinds of things, we are able to get in touch with their emergency contact and work out what could be going on. So with COVID-19, we actually saw an increase in people coming to us for home delivered meals, an increase in over 40%. So that need has not gone down at all. I think with the growing senior population throughout the state and the country, we are not going to see that need go down anytime soon. And a lot of the people that came to us probably already needed our services and just heard about us because of the pandemic. And so we're happy to continue to serve them into the future. We also have some folks that came to us who probably were more mobile and were more able to get their own food, but were sheltering at home. And after 2 years of isolation and not being physically active, they're no longer quite as mobile as they once were. So it's really important for us to be able to continue the service and to be able to nourish our elder neighbors.
Thank you. Mayor Pro Tem?
Thank you for the update on this, and I've always appreciated the opportunity to ride along on one of these delivery days. Now that you're delivering only once a week to Mary, how does the daily check-in, it's really not a daily check-in anymore, it's a weekly check-in. Are you looking at some way to be able to follow up with each of these seniors that you're helping on those alternate days?
Yes. So we actually, at the beginning of the pandemic, had our drivers call on the days that they weren't delivering to check in with folks and see how they're doing. We actually had to establish a bit of a do not call list because some people were like, okay, that's enough. But we're able to check in over the phone when we're not there during the week. And so that's been really important and a way to keep in touch.
And I assume you're not delivering everybody's meals for 7 days on Monday, otherwise you'd have nothing to deliver on. Your delivery system would have broken down. So some people get it on Monday, some on Tuesday, et cetera. Okay, thank you for the clarification.
Yes. Yeah.
Thank you. And I don't have any additional questions on this one. So thank you very much.
Thank you, Caitlin.
Thank you.
Okay, next up we have Contra Costa Senior Legal Services for their Legal Services for Older Americans program. Meredith, can you please bring them in? Hi, Jason, you have 3 minutes on the clock.
Great, thank you. Yeah, I'm Jason Schwartz, Executive Director with Contra Costa Senior Legal Services. Nice to be here. I'm a resident of Walnut Creek, so shout out to Walnut Creek. Since the mid-70s, you may know we've been helping people 60 and over stay, who live in the county, stay housed, defend against elder abuse, defend against debt collection, things that can affect their financial stability, and help them plan for incapacity, powers of attorney, advanced healthcare directives, simple wills. We have 5 attorneys plus a large group of volunteer attorneys that we manage. There's pretty limited free legal or low-cost legal help in the county, so we feel we fill an important need. We've also, obviously, seniors get exploited a lot through their vulnerable situations, and they're getting targeted pretty hard with sophisticated scams and fraud at the moment. So it's a challenging time for seniors, especially with rising inflation, and a lot of them are on fixed incomes. So a big area we work in is housing. We've had a pretty big increase in housing matters in Walnut Creek in the last 4.5 months. It went from 38% of our caseload to 58% of our caseload. We've had 15 out of 26 total cases in Walnut Creek, where we've helped seniors in Walnut Creek since January 1st. 15 of those have been housing cases. We've noticed it's very important to have legal assistance in eviction type matters. That really affects the outcomes, either allowing the senior to stay housed or at least negotiating, using a legal strategy to negotiate more time to search for alternative housing. Because if they get evicted on a short notice, it's a really difficult environment to look for alternative housing quickly. So yeah, we're pretty busy with those types of cases. We're also in Walnut Creek, our numbers are down since pre-COVID, but they're kind of coming back. We do have a clinic at the senior center there that has been pretty slow with signups, but we're undertaking some strategies to try to get those numbers up. And I think seniors in general are going to be starting to come back out to attend those. We partner with groups like Meals on Wheels to distribute flyers to build awareness of these clinics and other services. And yeah, I think in total in Walnut Creek, we've had about 65 cases since July 21st. There's some of that's consumer cases. 38% was housing, 11% was elder abuse, 22% was advanced planning for incapacity. Thank you for your time.
Thank you. Mayor Pro Tem?
Thank you for the summary, and the services are clearly very important. I'm just curious, Meals on Wheels was here previously, and they were talking about 60 years and older. Medicare considers seniors at 65. You say 62. Is there some standard across this country as to who's a senior and who's not?
We actually help 60 and over, but I think under CDBG, it's 62 is the minimum.
I was just hoping it might be 75, so I did have a stretch before I was actually considered a senior.
I know. I feel like I'm almost eligible for all these senior communities that are 55 and over, which is kind of humbling. But
Oh, trust me, I'm already there. Thank you.
And
but
63.
it's driven a lot by the funding sources have requirements. So we do 16 over because our main funding requires that.
And 63 is very young. I just want everybody to know that. My question is, we had a number of speakers at a city council meeting a while ago talking about building owners taking action against tenants to try to force them to leave voluntarily rather than doing evictions. Have you seen that in Walnut Creek?
A little bit, yeah. I do a little bit of housing work. I have another attorney that's more into this who could answer that better, but you do see they're trying tactics to get people to leave voluntarily and not repairing. For example, a lot of tenants are scared to assert their right to repairs and habitability because they feel like that's going to lead to them being evicted. So there's a lot of rent increases going on, obviously, too. But there's, some attempts to, make up a pretext like I'm going to move in, or I'm going to have a family member move in. So that fits under an exception to the eviction rules, for example. But, and it's hard to prove that they don't end up doing that after the fact. But we have been seeing that. And that's something we have some strategies to address.
Do you feel like you have enough tools in the tool belt at this point to,
Yeah,
beat those
once a
things.
lawyer gets involved, it really changes the dynamic in these cases quite a bit. It tends to get the landlords to back off or be a lot more careful in what they try and pull off.
Great, thank you.
Mhm.
Thank you, Jason. Next up, we have Choice in Aging for their Mount Diablo Center Adult Healthcare gap funding. Hi, Debbie.
Hi there. I missed the beginning of that. Were you calling me?
Yes. All right, you have 3 minutes on the clock.
I heard daycare and I was like, I think that's me. So hello, everybody. My name is Debbie Toth and I greatly, I'm the CEO of Choice in Aging. We're a nonprofit organization I'll get into in just a second, but I first want to just say I really appreciate the opportunity to speak and the difficulty in allocating scarce resources, and appreciate the opportunity to make the case since we weren't recommended by staff for funding. Sitting in a room and evaluating a piece of paper only focusing on services and costs doesn't tell the story of the last 2 years. And I would like to paint that picture for you and ask that you consider this when making your funding allocation decisions. So Choice in Aging has been providing services to disabled members of our community since 1949. We started serving disabled children with polio during a pandemic, imagine that, and now have over 4 decades of experience keeping frail elders and adults with disabilities out of institutions. This is really our sweet spot, and you can imagine why this pandemic was so jarring for us. March of 2020 put us to the test, and our adult day health care, that which we're asking for funding for, basically takes the staffing, exact same staffing in a skilled nursing facility, serves the people who would be living in a skilled nursing facility, but in a daytime program. So this model allows caregivers to have respite, go to work, do whatever, while their loved one comes to us, and creates community and has their spiritual, social, mental, and health and emotional needs met. Now we were decongregated. People couldn't come into the program, and we rose to the challenge. We delivered meals into home, care packages into home, PPE to the homes. We delivered exercise in parking lots, on front lawns, on back porches. We brought the road show out and did birthday parties in the streets with balloons and masked and distant, and made sure that all of the frail elders that we were serving were cared for. We didn't close our doors. As a matter of fact, we kept our doors open and redesigned everything we did. We lost our finance director February of 2020. We lost 20% of our staff through the pandemic, and yet we ensured that not only our people continued to get the services they need, but we reached out into the community. I was on the stakeholder advisory committee developing the master plan. We served as a resource to California Health and Human Services about how to respond to this. When vaccines became available, Choice in Aging partnered with the county and delivered vaccines to over 100 different congregate care living facilities with frail elders, low-income seniors. We totally took this thing on and did absolutely everything we could to serve all the elders in our community, to ensure that they didn't live and end up in institutions, because the Journal of Post-Acute and Long-Term Care Medicine compared infection and death rates of people in Connecticut nursing facilities to those who received community services, and demonstrated that people receiving services in the community were 11 times less likely to get infected with COVID-19 and die than their nursing facility counterparts. So, we went through some challenges, but we never stopped service delivery. And I would encourage you to keep that in mind when you're making your decisions. Thank you.
Thank you, Debbie. Questions, Mayor Pro Tem?
No.
I guess my question is, the staff recommendation that we have before us now talks about application being late and financial reports coming in late. And I wondered what you're doing with your office structure right now to address what sounds like a problem.
It doesn't just sound like a problem, it was. So like I said, our focus and our energy was on saving lives. We weren't trying to backfill positions in administration. We were trying to get people on the streets delivering services to our frail elders. And we were, almost a quarter less staff to try and figure out how to deliver those services in a whole new way. So our focus was not on replacing the finance director with somebody who fit our, we just didn't have the capacity to do that. And so, yes, reports were late. I have historically, I've been at the organization 20 years, and for 20 years, almost all of that 20 years, I've written all the grants, I've done all the presentations, I've done all the government work, I've done all of those things, plus provided services, and I just couldn't do it. There was way too much going on that I had to navigate. And so I had someone else submit the grant, and it was late. Our finance department has suffered for sure. But I will let you know that we have restructured, and I have a chief of staff who is working with me to submit grants so that nothing goes out that I'm not looking at and a part of. We have a new finance director that has reorganized our entire finance department, and we're doing cross training of all of our staff. So we're managing all of that now. It's sort of like the aftermath, and we're sort of putting those pieces back together. But our service delivery and saving lives was what was most important to us during the last 2 years. And I think we rose to that challenge.
Thank you, Debbie. No more questions? Thank you very much.
Thank you.
Debbie. Okay, next up we have Empowered Aging for their Ombudsman Services Program.
Hello.
Hi, Nicole. You'll have 3 minutes on the clock.
Wonderful. Hello, all. My name's Nicole Howell. I am the Executive Director for Empowered Aging. I want to thank you for this opportunity to come and present to you, our longtime supporters and funders in Walnut Creek. So as a reminder, Empowered Aging serves 3 counties, Solano, Contra Costa, and Solano, with a variety of services: friendly visiting and telephone reassurance, elder abuse prevention and intervention, but our really core service is long-term care ombudsman services. So we are a federally mandated program to work with and on behalf of residents and their families who live in long-term care to address issues of quality of life and quality of care. Everything from food or medication or roommate issues to the very serious and egregious risks of discharge and neglect, and really serious systems issues for the facilities that include things like helping evacuations during PSPS or ensure that they have supplies. To my earlier speaker and friend and colleague's point, Debbie, we did a lot during COVID. We distributed PPE to all the facilities in Contra Costa County in the early days when you couldn't get any. We assisted Choice and Aging with pulse oximeter delivery and supports to the small 6-bed facilities. And we worked with public health to educate both facilities as well as workers in the nonprofit space in the Contra Costa community about the vaccine as it was rolling out. Consequently, we had a higher uptake of vaccines in our facilities than other areas of the country in the early days, and we continue to see that really close relationship. Over the last few years, as you know, no one was permitted to enter long-term care facilities beginning in March of 2020, but our program was some of the first back into the facilities in August of 2020, going in full PPE, looking sort of like, the physicians in ET when they come to study them. So our staff have been fully back in and working with residents for a year and a half now, and the issues we are seeing are really fraught. There is a significant shortage of staff in long-term care facilities, which is why we do our work around the healthcare career pathway with our partners Opportunity Junction and Mount Diablo Adult Education to create an innovative pathway for direct care workers. The last years have certainly been challenging, and to some earlier questions around the age of folks. So we serve everyone who lives in long-term care that is primarily older adults, but we do have some younger folks who have maybe had traumatic brain injury or other illnesses. And I also want to say part of that confusion is recently we have lowered the age in the state around adult protective services to be 60. So that is why sometimes there is a discrepancy of who different organizations serve. And I'm happy to take your questions.
Thank you, Nicole. Mayor Pro Tem?
Thank you so much for the presentation, and I know this work is really important in our communities and these long-term care facilities. It seems that we have a lot of them in Walnut Creek. Can you tell me how many facilities you think we have? we were working on trying to make sure they were all covered during the census, and a lot of people was like, we don't even know where to look. Yeah, it was interesting. But also, do you cover board and care homes in this continuum?
So first of all, I'm happy to share my list with the city. We maintain it and check it quarterly against licensing websites. So we have, I just looked at the list, just under 100 facilities currently licensed in Walnut Creek. That does include what you're talking about, which is called board and care, licensed board and care. It also includes those fancy assisted livings. You see those out in Ignacio Valley Road. And then the skilled nursings that we see off Olympic near Rossmore and others. So we really run the gamut in Walnut Creek as the center of the county and a central around a lot of medical facilities. So you have just under 3,000 residents in your community and licensed long-term care facilities. You also might be talking about, the small, we certainly cover those. But there's also popping up what are called unlicensed facilities, which are facilities that have not been approved through Department of Social Services, but they're almost running like a 6-bed sort of off the record, maybe providing IHSS hours or working and saying they're not providing care. So that is something to be looking out for as you are looking at development. That in Walnut Creek is a really attractive place to be, and folks are going to alternative levels of care, but are not protected as well as they could be in a licensed facility.
That's very helpful from a different perspective, which is the planning and permitting process, to remind ourselves that there are a 6-bed unlicensed facility is probably not allowed under land use regulations, but a 6-bed licensed facility is allowed in a single-family neighborhood under the state's laws. So thank you.
Thank you.
Thank you, Nicole. And then I don't really have any questions. I just love the new name. So
Thank you. May I pick up on something you asked the last organization, and I think I have to own also, is that over the last 2 years, we've had a significant staff departure. Infrastructure's been challenging. And I just want to own that, like, Shaluna and Meredith have been amazing. And it has taken me extra time too, because it was only me. And so I just want to acknowledge that and thank the staff for their time.
thank you.
Thank you, Nicole. Next up, we have the Public Services Crisis Intervention Services funding category. We have Contra Costa Family Justice Alliance for their Family Justice Navigation Program. Hi, Natalie. We have
Hi.
3 minutes on the clock.
Thank you. Good morning. My name's Natalie Olias. I work with the Contra Costa Family Justice Center. I'm the Central Center Director for our office based in Concord. And just as a reminder, I know all of you know this, but the Family Justice Center works with survivors of interpersonal violence. That includes survivors of domestic violence, sexual assault, child abuse, elder abuse, and human trafficking. We have 3 centers throughout Contra Costa County, and we really try and be a one-stop resource where we have partner agencies that are on site, and we partner with over 65 agencies to try and get resources to survivors faster. And the way that we do that is through our navigation program. Our navigators are resource experts, and they are really tasked with the crisis intervention of hearing what's going on in the situation for a client, and then knowing what resource is available in the county to make that direct connection happen. And if our model is working correctly, that partner agency is on site. So instead of just giving a phone number to somebody and say, hey, give them a call, you're actually connecting somebody who's in active crisis to a real person who's going to be able to assist them with their needs. In between 2020 and 2021, we saw about an 18% increase in our clients. We served a little over 5,200 clients last year. About 2,200 of those were out of this central center in Concord. And one of the main things that we kept hearing from our clients were they needed more support in helping file restraining orders. They needed more support in mental health counseling. Those were the 2 biggest needs. And so last year, we really focused our efforts on trying to create new programming so that we can offer mental health counseling for anybody of any age, as long as they identify as a interpersonal violence survivor. It doesn't matter if you have insurance or not. We also started our Trauma Recovery Center in July of 2021, and that allows for victims of violent crime to be able to get therapy resources, as well as they can work with a licensed psychiatrist and get medication prescribed if needed. We also have our legal incubator program, and last year we expanded to include more hours to assist in writing restraining orders completely free of charge. We get them filed here at our centers as well, just to ensure that our clients are getting the support that they need. And we're really trying to adapt our programs to ensure that we're meeting the needs that are out there and that are ever changing in this COVID environment. And the only way that clients get connected to those is through our navigation program. So I thank you so much for your time, and I'm happy to take any questions you might have.
Thank you. Questions? No, thank you. And I too have no questions. So thank you very much for coming in and presenting today.
Thank you. Appreciate your time.
Thank you, Natalie. Okay, next up we have Community Violence Solution for their Children's Interview Center Sexual Assault Intervention Program.
Hi, good morning.
Okay, you have 3 minutes on the clock.
Hi, good morning. My name is Pat Morey. I'm the director at the Children's Interview Center, a program of community violence solutions. I'm also the senior forensic interviewer. Here at the Children's Interview Center, we work in collaboration with all the law enforcement partners in Contra Costa County, Child and Family Services, the DA's office, and health services in the county. We interview children primarily ages 2 through 17, victims usually of sexual abuse, but also victims of physical abuse, sometimes witnesses to domestic violence, homicides, shootings, other violent types of crimes. On site, when the child is getting their interview done, we have a case manager that works with the non-offending caregivers and provides links to services in therapy. One of the programs that Community Violence Solutions has implemented over the last couple of years is the Hope Therapy Program. So we're able to refer clients not only to outside resources, but also internally for free therapy for the child and their family members. We also have a pediatrician on site. So after the interview, if there are any concerns, usually it's not an acute type of thing that would go over to the hospital, but if it's a non-acute exam, we can provide that on site as well. Sometimes just talking to the pediatrician, puts the parents' minds at ease, or the victim, the child or teen victim. I'm really proud of the fact that even during the pandemic, we still had our numbers really high. In this last year, 2021, we conducted 508 interviews. Those are all, again, children ages 2 through 17. And we also serve a population of any adult that has a delay. So sometimes, I think the oldest person I've interviewed was 85, but functioned at an 8-year-old level. So they just kind of misnamed us back in the day when they called us Children's Interview Center. We did 21 interviews for Walnut Creek last year. And even in 2020, during the height of the pandemic, a lot of agencies were closed, but I was really proud of the fact that we had staff that responded for interviews. And we still did 413 interviews in 2020. So even though we didn't do our average of 500, it was still a really high number of kids that we were able to see here. We are staffed with just 2 interviewers and myself. And compared to Alameda County, they do about 800 kids and they have 6 interviewers. So I'm really proud of what Contra Costa is able to do with so few people. Thank you for your time today.
Thank you very much. Questions? My only question is, going forward, do you expect to see, as we all come out of COVID, an increase because people have just delayed seeking help, or do you feel like we've kind of kept up with the wave?
Yeah, I think we've kept it up with the wave. Even, my concern was when kids weren't in school,
Yeah.
a lot of times things weren't getting reported, right? Because we do get, referrals through the schools, like through teachers and stuff. But what I noticed that kids are really resilient during 2020 when all the kids were doing Zoom classes. We had children that were being abused in the home and actually typed messages to their teachers saying, I need help, things like that. So it was really encouraging to see that things were still getting reported. I think that since kids have gone back to school, definitely it's been really busy this year so far. And, we're only 5 months into the year, and I think we're going to far exceed the 500 average that we normally do. So yeah, I think, in answer to your question, we were still seeing a lot, obviously with over 400 kids in 2020 and everything was shut down, it was still pretty busy.
Yeah, well, thank you for the work you do.
Well, thank you.
All right, thank you very much.
Our next person was supposed to be here via Zoom, but they are not in the attendees, so we just move on?
Okay, so next person is Contra Costa Crisis Center, but they are not on Zoom yet. If you are, can you please raise your hand?
Oh, let's see. Leslie Garcia is raising her hand. Okay, I was told Tom would be there, but.
Okay, this is for the Contra Costa Crisis Center 211 Crisis Line Program. And it looks like we do have someone. Hi, Leslie.
Hello, good morning.
Good morning. Okay, you have 3 minutes on the clock.
Great, thank you. So my time starts now. Thank you. My name is Leslie Garcia. I'm the Director of Programs at the Contra Costa Crisis Center. So the Crisis Center was founded in 1963. We are accredited by the American Association of Suicidology. We follow the Alliance of Information and Referral System standards. We have a professional staff of 22 and over 100 highly trained volunteers that help us with all of our services. All of our services are free, confidential, and provided 24 hours a day. Our mission is to keep people alive and safe, help them through crises, and provide or connect them with culturally relevant resources in the community. We provide services 24 hours a day in English, in Spanish, and we also have a language line that provides over 150 additional languages. We provide our 24-hour crisis line services, our 24-hour 211 information and referral line services, a 211 online resource database with over 1,600 resources available to the community and to service providers. We provide grief support groups, mobile grief counseling when there's a suicide or accident in the community, and we have a diverse team with bilingual staff and volunteers. Last fiscal year, we answered over 66,000 calls and texts. Our top 5 crisis line issues were anxiety, stress, depression, relationship issues, suicide intervention, and psychiatric services. And our top 5 211 issues were homeless services, mental health, financial assistance, rent and housing assistance, and substance abuse. We do have a success story in a woman who called the 211 line. The first time caller, she was homeless, living in her car with her 9-year-old daughter. She's a single mother. She called 211. We were able to connect her with our core mobile outreach team for immediate support. The core was able to give her food and basic hygiene supplies to the car. They encouraged her to go into a family shelter, but she refused because her daughter didn't want to leave her school. So they were living in the car near the school district. 211 was able to provide her with rental deposit assistance connection to the Season of Sharing program. And this caller was able to connect and get that rental assistance that she needed.
Thank you very much. Mayor Pro Tem?
Thank you for the services and for including the community to be able to give back by being volunteers. I know that's a great program. With the advent of the A3 program, Anytime, Anywhere, Anybody, Anytime, Anywhere, that Contra Costa County is moving forward with, how do you see the Crisis Center integrating with that?
Well, with that program, we answer the 24-hour crisis and suicide hotlines. We are the ones that answer that 24-hour hotline. We are also the ones that answer the National Suicide Prevention Lifeline calls. And so it sounds like what they're trying to do is create an additional hub where we would be calling this hub instead of calling police for a wellness check directly, like what we do now and what we've done for over 60 years, or the adult mobile crisis team directly. It sounds like they're creating a hub that we would then call the hub, who would be the dispatch to either police or mobile crisis response team, whether it's the youth team or the adult team. So again, we are the ones that answer the crisis and suicide hotline calls for our county, and we've done it for more than 60 years now. We also answer the national line.
Great, thank you.
My question has to do more with the 211 side of things and the homelessness. I know people like BART now has officers on, or care outreach workers on the trains and things like that. Are you seeing, are there ways that we could be more efficient in getting the message out about calling 211 for homelessness? Or are you?
So definitely the core mobile team that is BART Police is one of the teams. There's approximately 15 teams in the county. So the only way to get connected with CORE is by calling 211. So they have to call us first, and we are the ones that connect them to the CORE teams. So they distribute cards, they distribute wallet cards, getting the word out to call 211 for the resource. It's an easy 3-digit number instead of having to remember a 10-digit number to call for help. So the only way people can get connected to the outreach team is by calling or texting. People can also text us 24 hours a day to get those services.
Okay, thank you. And thank you for the work you do.
Thank you, Leslie. Next up, we have court-appointed special advocates for their Serving All Foster Children program. We have an in-person presenter for this one. I'll start the clock.
So I want to start by telling you 2 surprising facts. We now know that 50% of the homeless in our community, probably more than 50%, are former foster youth. And additionally, 50% of the prison population in California are former foster youth. Now, are these bad people? No. They had bad things happen to them as children, and they didn't get the help that they needed at that time. As a result of foster care children, more than 50% do not graduate from high school, and as a result, can't get jobs, of course. And many of them did not receive the mental health treatment that they needed at the time when they were children. However, I am the executive director of Court-Appointed Special Advocates. My name's Ann Rickson. CASA, all of CASA's youth graduate from high school or earn a GED, every single one of them. We also provide them with immediate mental health care. We have experienced mental health providers who volunteer 1 hour a week to provide teletherapy to youth for as long as they need it. So our children are getting the help that they need. Our CASA volunteers are the ones who are the one caring adult that every child needs to succeed as an adult. And finally, I just want to thank you all. I'm probably not going to need the 3 minutes for your help, because not only all of you individually, but Walnut Creek as a community has been amazing. We have hundreds of volunteers who live in Walnut Creek. And I don't know, I just can't say enough about how grateful I am for that. Because although, we're each different cities or whatever, the entire county is affected by the outcomes for these youth. And we want to do everything we can to ensure that they have good outcomes. So thank you.
Thank you. Mayor Pro Tem?
Oh, I'm sorry. Thank you for the work you do, and I've known many of the volunteers, and I know we all appreciate the work they do for the youth to try to make their adult lives something different than the path that they would otherwise be on.
Yeah, and thank you. Also, I share Mayor Pro Tem's thanks for everything you guys do. I don't have any questions now.
Okay, well, thank you.
Thank you for coming in person. It's nice to
Oh,
see
I
you.
agree. It was like, who is that sitting back there?
Thank you, Anne. Okay, next up we have Stand for Families Free of Violence for their Crisis Line program. Good morning, Rhonda. You have 3 minutes on the clock.
Great. Can you hear me okay?
Yes, we can.
Great. I never quite know. As you've mentioned, my name is Rhonda James, and I'm the CEO here for Stand for Families Free of Violence. And we are the domestic violence shelter-based organization here in Contra Costa County for the last 45 years, having our 45th anniversary this fall. And we are a participant and often a lead and certainly a partner in all efforts to stop violence against women and children, to stop violence in families. However, we're the only domestic violence specialized shelter-based organization. So we have a special relationship with many of our other shelters, partners with our law enforcement partners, with our medical community and our social services. And we really pride ourselves in staying in that network. So as you all know from the application, Walnut Creek has been wonderful at supporting our 24/7 crisis line. And the reason we have that crisis line alongside other important crisis lines in this county and across the country is that we're 24/7 available to do the kind of safety planning that often has to happen more than once when people are trying to figure out how to safely flee a violent home. So we, again, consistent with the application that you've all probably read far too many times, our 24/7 crisis line is the portal to all services. So even though most people who seek services are looking to get general wraparound services, even if they are not seeking shelter, and many are seeking shelter and housing, which is our _1 request, they use our crisis line multiple times to access other kinds of linkages to our other services, including advocacy, linkages to services for their children, court advocacy, medical advocacy, and access to our services directly. Our support groups, even offenders are calling to access our batterers intervention programs. So we're tremendously grateful for Walnut Creek for helping us keep that portal strong and open 24/7 multilingual crisis line that's staffed with volunteer staff combination. We've been able to maintain our volunteer population pretty strongly during this terrible pandemic, although it's been quite a creative venture. I'm happy to say that we continue to have 50 plus staff and about 60 to 70 volunteers if we include some of our leadership volunteers right now. I think our volunteer program is the one that has gotten hit the hardest because it was so hard to have folks on site. And just to remind everyone, we have emergency shelter for up to 24 adults and their children. They stay for 8 to 12 weeks. Some of them transition into our 2-year transitional housing program or other linkages in the community. We provide counseling, peer counseling. We also provide clinical trauma-based therapy work for children exposed to domestic violence, sexual assault, and other kinds of trauma. And we do a great deal of advocacy and general services for for people living in the community who don't decide to come into emergency shelter, which is where we see more of our Walnut Creek residents.
Thank you. Mayor Pro Tem, do you have questions?
You might have said this, and maybe I was distracted. During COVID, did you see a rise in the number of cases that you needed to address?
Yes, we saw the first few weeks, it was eerily quiet, and then we saw an increase in requests, and we saw an increase in ways that people were trying to reach us because people weren't feeling comfortable making a phone call where they could be overheard. So we had a lot of multiple calls. I'm going to go to my car and call you. He's here. My mother-in-law's here. People were really limited by their shelter in place. They weren't able to go to work or quote unquote drop their kids off and then make an appointment with us. So we did see an increase, but mostly what we saw and were the most impacted by is the lethality of what we did see. So when people did call us, for those people who were waiting because they couldn't safely call us, We found that the violence had escalated. We saw more strangulation and use of lethal means as part of the coercion. And the other thing we saw was a reluctance to seek wraparound services unless we could guarantee housing. And that was the biggest issue. Many folks needed to get into emergency lodging, which is what we had to do, like so many other shelters, right? To get people to live separately and safely and then bring services to them. But if we couldn't immediately house them, many of them didn't feel safe to even interact with us. We had more transactions and higher lethality, if that makes sense.
No, it does. Is it getting better?
It is going back toward normal. We are seeing the escalation of the lethality, however, continue.
Thank you so much.
That's heartbreaking. My question is, as the new 988 number and the whole mental health response team gets up and running in Contra Costa County, have you guys had discussions about ways to interact with the new call center when it comes on board?
Yes, the way that we would interact and the way that we are in conversation is our residential program, because although we have a shelter and transitional housing also, we also provide linkages in the community and prolonged services after folks leave our care. So that would be the way in which we are interacting with those conversations. It has to do with the fact that domestic violence is the third largest causer or indicator for homelessness. So that's the intersection for us.
Okay.
And the core team is something we actually, frankly, utilize every day.
It's a tough time for the world. So thank you for everything you do.
Absolutely. Thank you for considering the application.
Thank you, Rhonda. We have one more funding category before we take a 15-minute break. It's for public services, homeless services. So first up, we have Contra Costa Health Services for the dedicated core Walnut Creek team. Okay, looks like we have someone coming in. Hi, Michael. Good morning. You have 3 minutes on the clock.
Okay. Hello, I'm Michael Callanan. I'm the program manager for CORE. Behind me is Lisa Thomas. She's one of our CORE coordinators. For our homeless outreach program, CORE is Coordinated Outreach Referral and Engagement Program. We are part of the Contra Costa Health Housing Homeless Services, or H3, and are one of the 3 access points into the Contra Costa Coordinated Entry System. What does CORE do and what's it stand for? CORE stands for Coordinated Outreach Referral and Engagement. We are the mobile outreach program that works to engage and stabilize homeless individuals and families that live outside through consistent outreach, and we facilitate and or deliver health and basic needs to secure permanent housing. We work primarily with the unsheltered population to help them bring them inside. To give a CORE structure overview, just to give a quick overview, we have our current team structure. We have myself, the program manager, 3 coordinators, and we have 13 different core teams. Some of our teams are specific to the national or populations or geographic, such as your Walnut Creek team. Like I mentioned, CORE is one of the 3 access points into the homeless system of care. To access CORE, people call 211, press 3 to speak to our dispatch line, and it transfers over to us. We also have 211, our call center that provides the resources and referrals, as well as the 2 care centers, the drop-in centers in Richmond and Walnut Creek, and the core Concord Service Center. The types of services that are available in our system of care are prevention, diversion, temporary interim housing like shelter, permanent supportive housing, and other services such as housing navigation. Our work would not be possible without the help of our partners such as Shelter Inc., Trinity, GRIP, Bay Area Rescue Mission, Hope Solutions, Contra Costa Crisis Center, and many more. CORE is the mobile front door into the homeless system of care. We provide ID waivers for people to get IDs, transportation, when possible, linkages to benefits and behavioral health, direct placements into shelters, emergency supplies, and help with encampment and abatements. Some of our trainings that we do for our teams are motivational interviewing, housing first model, harm reduction, low barrier shelter programs, nonviolent crisis intervention, conflict mediation, and we have Narcan and CPR trained. Referral system where, well, while each of our dispatchers take lines or take calls each day, we also work very closely with the local hospitals and discharge planning to get people outside connected to the hospital or connected to the hospitals that should need medical care. For our COVID response, we have added a few services. Some of our services we offered during the pandemic were food support and distribution. We did 3-day packs of food, health and sanitation, safety and survival supplies, training and education, and encampment displacement support. Linkage to shelter and hotels, testing and vaccinations. We supplied many COVID tests out to the homeless population. And then we also do fire and safety risks.
Okay, thanks. We'll see if we have any questions. Thank you, Michael.
What do you see? Thank you very much for your presentation. I know 3 minutes goes really fast. What do you see as the biggest challenge today in the work that you do?
I would say our population of aging and finding affordable housing, because even though we have some vouchers and things like that, there's the challenge of getting landlords that want to rent to people with low income, and also even with the vouchers, the rental being higher than the vouchers will support.
Thank you.
Thank you. And then I know we've just started to see the results of the point in time count from February 24th. Are you guys continuing to see numbers go up? I know Lisa's been reporting out increased numbers of contacts.
Yes, we continuously, like with somebody mentioned earlier, the evictions from people, the moratoriums, we're seeing people from that. We're seeing a lot of families, a lot more families. Like our families team is doing 40 to 50 families at a time, and we see families where we used to see them maybe once a month or two times a month in the beginning when we first started. Now we see 1 a day, 2 a day, 3 a day. And so our biggest challenge is probably when it's a man with a child, because there's not as many supports for them versus where we have a woman and a child. So.
Okay, next. Yes, Michael. The next program is for the core countywide program. We'll have 3 minutes on the clock for that one.
Okay, so I kind of went over the whole core thing for that, but I'm going to go over the numbers for them. So on the core team C team, they are the access point into the warming center. They have the 6 beds at the warming center that they fill each night, which a lot of them are filled out. We work with the Trinity Center to fill those beds. The warming center opened on 8/16 during being closed for COVID, and I did a report from 8/16 to 4/30. They made a total of 222 contacts, 49 which were unduplicated. There was 47 individuals and 1 family. Out of the age at intake, 2% was 18 to 24. Ages 25 to 61 was 75%, and the seniors for 62 plus was 22%. A lot of the health indicators that they had, chronic home, or 23 reported chronic health conditions, 10 reported developmental, 25 mental health problems, and 25 with physical health problems. 95% of those people that's seen received emergency supplies. And then for warming center coordination, they were able to place, there's 45 unduplicated clients, but they placed 93% of those people into the warming center. And then they also kind of go over with our regular team. They work together, and I have a couple of success stories of combinations. We met Trinity Center. We met CW at Trinity Center. He had been homeless, sleeping in his car for the past 3 years. We were able to place her in the warming center for a couple of nights, and then got her into the shelter. After being in the shelter for a couple of months, her name came up for an apartment. She will be moving into her unit as soon as it's ready. That's one. We were able to get GW in his birth certificate and his ID so he could go to his job in San Francisco. After getting his documents together, he was able to get a job in San Francisco. And we have JH. We met JH at Trinity Center. This was the first time being homeless. He was a banker, and his drinking had started getting in the way of his normal living. He wasn't able to hide his drinking, and he needed help. We got him into detox. And from there, he went into a program where he is still living after finishing the 1-year program. And then the next one is a rapid resolution. RT has been in Trinity Center for a while. We assisted him to get his EBT card and GA. Also took him to get an ID. After speaking to him several times, he mentioned that he wanted to go back to Colorado, where his parents were. We made calls to his parents who stated that he could come back home. And we purchased a ticket for him and got him to the Amtrak and got him there.
Thank you. I always love hearing that. I love the one about the young man going to Colorado. So,
we have actually a bunch of those. Like that's one of our good things of getting people back home. So
yeah,
rapid resolution works really well.
So could you repeat, thank you very much for the presentation. That was a lot of data that I want to hone in on. How many in Contra Costa you pick the year are actually going through the warming centers? Because I know there are multiple. And how many are we able to house through these programs? If that's the path where we're trying to go.
I didn't pull a report for actually how many gets housed, because basically the C team is just their basic job is just to get people in the warming center. All the other teams are working your actual Walnut Creek team, and anybody in Walnut Creek, they're the ones that are going to be working with people getting housed. Okay. And in that, I do have some numbers from there. Their report was pulled from 4/1 of last year to 4/30 of this year, and they did exit 3 people into a substance abuse and 3 people into permanent housing. For that time.
Great, thank you.
Which they do work with the C. That C team is just basically getting them into a place so we can keep touch with them. And they have if they want to get them into, I know the people that get into programs, sometimes they want to get into programs, we won't be able to get into the next day, so that they'll work with the C team to get them into the warming center for the night, so we know where they'll be the first thing in the morning to get them to the program.
Okay, thank you.
and I guess my only question is the warming center big enough? I think
Never.
I know the answer.
Nothing is ever big enough, because the shelter, as you guys know, was remodeled due to COVID, and the population, I think it used to hold 78 people, and now it holds, I think, 62. And the warming center, or when they revamped everything, they put cubicles in, and in the kitchen where we used to use as a warming center to hold the 30 people, that is now cubicles, so it has male and female dorms in there. So it is a lot more person-centered and things like that. But we did lose some beds at the warming center. Now there's like 2 little rooms, so we have only 6 beds available.
And I'm curious what you think the trade-off is, because I know there are people that would not go to the shelter because it was kind of ooky. And so with the cubicles, I've heard it's a better experience.
It is a much better experience, and it also, with the remodel during COVID, they can have pets there, and they have an actual little park in the back parking lot is now a park with dog kennels. So they have one of the biggest barriers is pets, and we are able to put people with pets in there.
Great, thank you.
Thank you, Michael. Next up, we have St. Vincent de Paul of Contra Costa County for its homeless prevention program, and we have presenter in person.
Great, thank you very much. Well, good morning. It's the team of Cindy's this morning, I see. And just have a couple of slides just so I get some numbers up there. St. Vincent de Paul of Contra Costa County services, provide safety net services throughout the county. We've got 29 branches.
Don't forget to introduce yourself.
I'm sorry, I'm so sorry.
Okay.
I'm Claudia Ramirez. I'm the Executive Director of St. Vincent de Paul of Contra Costa County, but I'm also a volunteer, what we call Vincentian, here at the one of our Walnut Creek branches at St. John Vianney. So I wear both hats. I've been a volunteer for 11 years. I've been ED for 4. We have, like I said, 29 branches throughout the county, and 3 of them are here in Walnut Creek. 2 of them provide more pantry-focused services at St. Mary's and at St. Stephen. And then at St. John Vianney, we really do a lot more of the person-to-person service. And when we get back out of COVID, we do our home visits where we really work with people. Go ahead, if you could. Last year, we served approximately almost 3,200 people out of our Walnut Creek residents, or I'm sorry, people out of our Walnut Creek branch. About third to 50% of those are Walnut Creek residents, because we do serve quite a bit from the Monument corridor, because when we kind of first started serving, there wasn't a lot of need from actual Walnut Creek residents, and that has changed dramatically in the last several years. We do everything from housing assistance, food guards, back to school program, Christmas programs, and then referrals to additional services, seeing the core group here, seeing Trinity Center outside, so we do serve, quite a bit in collaboration with our other agencies here. Next slide. In 2021, just to give you an idea, we dispensed about $188,000. That's direct aid. That doesn't count any of the in-kind goods and services that we do from the branch at St. John Vianney, of which about $70,000 of that was for Walnut Creek residents, averaging about $1,000 per household that we help, primarily in housing, as you see. $63,000 in housing assistance to Walnut Creek residents. Right now, our fiscal year is October through September, so we're 7 months into our fiscal year. We've given over $118,000 in assistance, and at this rate, we're tracking to, give about 10% more, 12% more in assistance, probably with similar breakdowns. We don't do the full breakdowns until the end. We find, as we've looked at data over the years, that once we help someone stay in housing or get housing either through a rent deposit, their likelihood of staying in housing for 1 to 5 years is about 77%. So that, I think is a good idea of where the funding will go and how it will help long term.
Thank you.
Thank you.
I just had a quick question on the utility assistance. Do you guys work with the utility programs to see what they have available? I know MC
yeah,
is into
definitely.
theirs.
A lot of the training that we get, even though we're volunteers at the branch, a lot of the training that we get is, what kind of programs out there. We've got a full resource library, so we have in there LIHEAP and I forget the new program that they have where if they pay a little bit a month, but if they stop paying, then they have to. We've been covering some of those bills where people haven't been able to catch up at LIHEAP and all the different other programs that are REACH and everything. So and then we also work with all the different utility companies, and of course every time we pay directly to the provider or the landlord or anything. We don't give money directly to the neighbor in need.
Okay, thank you.
Mm-hmm.
Thank you, Claudia.
Thank you. That was easy. Thank you.
Okay, next up we have Trinity Center General Operating Support Program. We have Leslie, who will be here in person. Okay. And then
Good
you have 3
morning.
minutes on the clock.
Thank you for having us. Greetings to you, Mayor Pro Tem Silva, Councilmember Darling. Trinity Center is just up the street. And because Trinity Center is here, Walnut Creek has a safe and welcoming place for people who are living unhoused to find welcome and safety and the basics that we all deserve and need: showers, meals, access to computers and laundry, telephone, and safe storage for very valuable personal items. I know you all know that. And I know that as a community, Walnut Creek has been deeply supportive of the work that we do, because you know the impact that we make. You know the difference between someone being able to be clean and presentable as they go for a job interview or a housing interview, or even just walking around the streets of Walnut Creek. Each of us being our best and safest makes the entire community strong and safe. So we are seeking support and funding from you again this year. Because we have an impact, a positive impact in the community, because our need is increasing, our role and the demand for our services is increasing, and because it's an investment, not only in what we do in Trinity Center, but in the community and the entire network that you're hearing from this morning. None of us operate in isolation, and an investment in any of us is an investment in all of us. So our impact includes more and more people being served each day, each week, each year. Last year, we served nearly 1,100 people, which was higher than ever before, and they are coming daily, occasionally, for all the basic services that we provide. You've long supported our program, so why in this funding round are we asking for an increase? two really pragmatic and simple reasons. There's an increased demand for our services, and there are increased costs. We want to be able to attract and retain and build a firm foundation in the community for quality employment among our staff. We want to be able to grow programs so that our members can access employment. We are an investment because we are providing those direct resources, and they are costing more. They simply are. No surprise there. But we are also leveraging community resources more and more every year. And because we are funded for our day program, a lot of volunteers and community resources are invested. We're part of a larger network. We are an opportunity now for anybody in the community to get a free, healthy, hot lunch through our partnership with Loaves and Fishes Contra Costa. So investing in Trinity Center, like all our fellow providers, is an example and just one way that you are truly and concretely showing that Walnut Creek cares about everybody in the community. Thank you.
Thank you, Leslie. Questions?
Thank you so much for the work you do, and I look forward to this evening's event, and I know the other Cindy does as well. Help me understand, the 1,100 that you're serving, are those 1,100 unique individuals, or is that your head count over 52 weeks?
That's 1,100, just shy last calendar year, 1,092, so round up to 1,100. And we're already on pace to exceed that number this year, but that's unique individuals who are coming, some every single day for months, some just every now and again for the basics or to collect their mail, also another important service we provide. And some we see once or twice, and they find out from us how they can get connected to other resources. So we don't see them all the time because we're making sure they're connected with the broader network of resources to help meet their needs.
And of those 1,100, what percentage do you think are Walnut Creek based? This was their home originally, or that's the question.
A significant percentage, and certainly many now by virtue of the fact that they're coming to Trinity Center, if they're still living unhoused on the streets, are probably in the highways and byways of Walnut Creek. But many of them do call Walnut Creek their home. I would estimate probably 10 to 15% historically would say that. Where they last slept isn't always Walnut Creek. And being right on the BART corridor does affect the fact that it's easy for people from the whole community and county to get to Trinity Center. But it's not an insignificant amount. And once they're here, they are part of the community. They're volunteering at the street festivals. They're shopping at Trader Joe's. They're hanging out in the library. So.
Thank you.
Thank you. The only question I really have is, have you seen any progress? I know we've talked about setting up services out in East County. Is that still something that's progressing, or do you know much about what's going on there?
It's clear from conversations that I'm part of and the news that we see is there's a deep need for services out in East County. Trinity Center is willing and able to help in that regard. Antioch is doing some very creative work, but Trinity Center right now is not going to be a part of that, but we stand ready to. So.
All right, and the program that you have for the youth, the homeless youth, tell me a little bit about that.
Sure, that's one of our success stories, if you want to call the fact that our young people are living unstably housed and need Trinity Center at all. But through our new program, which isn't that new now, we have been able to connect with youth who are in college, employed, sometimes even parents themselves living unstably housed. They don't have to meet the formal HUD definition, but we are able to bring them into the center, ground them, do a lot of work with them on employment, because outside of housing, that's their number one priority goal, is employment, and do it in a way that is specific to their youth group and meets their needs and helps them feel welcome at the services at Trinity Center. You'll hear me say this in the evening program presentation here as well. This year, for the first time, we had young adults part of our evening program, and then we were able to connect them to other resources in the county. So that's been huge, that they feel safe coming to Trinity Center. We connect with them in the county. We get them employment in a way that builds their self-confidence and gives them then the financial tools to regain stable housing.
Okay. And now, for something completely different, the evening program.
All right, Leslie, you have 3 minutes on the clock.
Sure. We are once again seeking support and funding, not only funding support, but support as an institution and in a program for our evening program. Historically, it has operated from about December through about March or April each year. It's operated out of the Armory, you all know that, but with Trinity Center as the grounding point. So our program involves people coming each evening to Trinity Center, getting a hot, healthy dinner, and then being transported over to the Armory where they stay and sleep and come back in the morning. So it provides a way for people to have safe, warm, overnight sheltering, along with healthy meals, and then they come back to Trinity Center during the day, at least those who aren't working do. Some people are using evening program each year as a safe place to sleep so that then they can take a little bird bath and then go off to work, but knowing they've got a place to sleep at the next night after work. But the rest come back to Trinity Center where we work very, very intensely with them to help them meet their housing goals. And we've had another successful season in this past year, which was different from the year before. We were able to house fewer people than historically, and that is one of the realities of the program. With the COVID protocols that we had to put in place 2 years ago, and then slightly lighter this year, we have not been able to serve as many people because we have to keep people distanced, and we have required full vaccination and booster shots. And some people, just like members of the general population, that's not what they're going to do. So we are not able to necessarily fill the full need for shelter capacity here in Walnut Creek, or certainly within the growing need in our community, as we all see in the newspapers. But for those who do come, they are finding community, they're supporting each other. I've seen some amazing moments where they're helping each other through sickness, helping each other find jobs, helping watch each other's pets and stuff. And then we're really, really focusing on housing. And we've had some great outcomes even in this last year. We served 26 different people. And of those 26, 4 have exited to permanent housing. 1 was able to be placed in one of the county shelters. That was one of our youth. And that was really important to even have her be able to trust us to come in overnight and then move on to a shelter experience. I think we can take credit for that. And she's well on her way now. 5 are working or increased their ability to work. We connected a lot of people with rapid rehousing, which it takes a while, but we are connecting them with that community service. 5 have been able to leave and stay with family and friends after the shelter stay. 1 has gone into an SLE, a sober living environment, which is really important also as a long-term placement. So each of those individuals and the ones that we're still working with come to the center each day. We're providing ongoing support, and your investment in our evening program helps make that happen. Thank you.
Thank you. Questions?
No, I'm good. Thank you.
My only question is, I know we've talked through the years about the difficulty in because the Armory requires a new permitting process every year, and so there's a lot of expense associated with it. Has anybody started thinking about where we might set up a longer term, less bureaucratically arduous winter shelter?
We are always thinking about that and always exploring opportunities. It has not proven fruitful so far for a number of reasons, but we are always on the lookout for that, because if it costs less, we can maybe do it longer and offer more shelter services and meet the need in a bigger way in the community. So the answer is yes, we're always on the lookout, but we haven't found such a thing yet. No. And so until then, we are glad that we have the Armory so that we can provide this service during the winter, and people not only have a life-saving experience, but a life-changing experience.
Thank you.
So,
Thank you, Leslie. Okay, so now we will take a break and resume at 10:45.
And we're back.
Okay, so we have the next category, public services for other social services. We have Cancer Support Community for their Cancer Support Community program.
Hi, good morning, everybody. Thank
Good
you
morning.
for your time. You know, and I kind of missed the first couple of words there. Am I being set up am I starting my presentation now?
Yes, you'll have 3 minutes on the clock.
Okay. Thank you all for your time and the opportunity to share more about what Cancer Support Community does. Sorry, one second. I want you all to imagine a completely full United Airlines plane. That's about 200 people who are just going about their lives. Next slide, please. And next slide again. Sorry about that. Every hour of every day, a plane full of people are diagnosed with cancer. And that number is increasing and projected to continue to increase. Next slide, please. Here's a quote from one of our members. She mentions needing connection. CSC provides that connection, but we do so much more than that. We provide truly comprehensive care to treat all the ways you as a person are affected by cancer. We do that through creative writing programs and music groups, through support groups and one-on-one counseling, exercise and mind-body classes that address the physical side effects of treatment, and educational workshops hosted by leading professionals. Anything from clinical trials to diet and nutrition. Next slide, please. And cancer affects the whole family. So all of the programs that I provide, that I explained we have for cancer patients, we also have for caregivers and loved ones. Next slide, please. Negative thoughts, stresses, and concerns affect one's health. And a cancer diagnosis brings about all sorts of negative thoughts. And so we actually improve health outcomes by addressing the entire psychosocial component of cancer. Doctors treat disease, and we address how cancer affects the whole person. Next slide, please. These are our photos of some of the people we served over the years and a list of how we go about improving the lives of people affected by cancer. Next slide, please. Cancer is one of the most expensive diseases to treat. In 2018, cancer patients in the US alone paid $5.6 billion out of pocket for treatments. On top of that, there are all the non-pharmaceutical costs, such as transportation to treatment, lost wages, caregiving costs, and secondary effects like wigs or special dietary costs. So even for middle-class families, cancer is a financial crisis. Someone who wasn't previously can become low income after going through cancer treatment. So we provide all of our services at no cost to be readily available. Next slide, please. I'll just end with a quick quote from one of our members. They say, "Thank you for being a critical part of my healing. I don't know how I would have managed my cancer without all the services and support offered at Cancer Support Community." That concludes my presentation. Thank you.
Thank you. Mayor Pro Tem, do you have any questions?
I don't today.
The only question I have is when we were looking at this, the staff identified the service to low and moderate income population as being an important criteria. And it sounds like that's something that they're looking for. Do you have any information on what percentage of your population is in that category?
Yeah, so for the Walnut Creek Center, about 29% of the people that we serve are low income. And so for the city of Walnut Creek, we're reporting on Walnut Creek residents, but we hired an outreach manager and opened a center in Antioch to serve low income in East Contra Costa County. So it's a much higher of low income members in our Antioch Center.
All right, thank you.
Thank you, Andy. Okay, next up we have Echo Housing Fair Housing Services Program. Okay, looks like Margie is on her way.
Hello, good morning. My name is Marjorie Rocha. I'm the Executive Director of Echo Housing, and we have over 55 years of experience in the housing, counseling, and fair housing enforcement fields. Thank you for your unwavering support throughout the years. ECHO was founded in 1964 as a response to Proposition 14, which made it legal to discriminate against persons based on ethnicity, religion, sex, marital status, physical handicap, or familial status. A group of volunteers dedicated to equal housing opportunities worked successfully to repeal this proposition. Incorporated in 1965, ECHO's mission is to promote equal access in housing, prevent homelessness, and promote fair housing conditions. ECHO is a HUD qualified fair housing enforcement organization, one of the few agencies in the Bay Area which is qualified to do investigative testing in discrimination cases. Discrimination testing is a standardized form of investigation approved by the Supreme Court in 1982 to help uncover fair housing violations. In the Fair Housing Program, we provide counseling to tenants and landlords and investigate allegations of housing discrimination based on a number of protected classes, which include race, color, religion, national origin, disability, gender, familial status, ancestry, sex, sexual orientation, source of income, marital status, age, occupation, and other personal characteristics. We work very closely with the Department of Fair Employment and Housing, HUD, and private attorneys to restore fair housing rights to affected population. Another component of the Fair Housing Program is education. We believe that education is a necessary tool for compliance with fair housing laws, and we are accomplishing that with monthly virtual fair housing trainings. We also conduct an annual fair housing audit to determine levels of discrimination in Walnut Creek and other areas we serve. We are pleased that all the landlords in Walnut Creek involved in this audit were found to be in compliance with fair housing laws. In 2021, ECHO Housing opened 15 cases. 6 cases were counseled. 1 case was referred to DFEH or HUD. 5 cases were closed due to insufficient evidence. 1 case resulted in education to the landlord, and we did a 5-site audit. And last year's audit was based on discrimination against Section 8 voucher holders. I would be happy to answer any questions about the Fair Housing Program.
Thank you so much. Questions?
Thank you.
Thank you very much. You said there was an audit that found that of the Walnut Creek audited landlords, that they were 100% in compliance. What I'm hoping,
Yes.
what I'm hoping the answer to this question is things over time do get better because we are educating people about the importance of fair housing. Are
Absolutely.
you finding that our landlord, I mean, we have a lot of rental property in Walnut Creek. Are you finding landlords getting better?
Yes, they are. And you know, a lot of landlords just don't know that it's against the law to not allow emotional therapy animals, that it's illegal to discriminate against Section 8 voucher holders. And I think that the education is an extremely important factor. The audits are done strictly as an educational piece for us to find if there is this discrimination and then to be able to contact the landlords and provide them with education. It's not to penalize them in any way.
Can I ask one other question? A lot of our housing stock is single family, and they are rental properties as well. Are you addressing these one-off landlords?
Oh, yes, absolutely.
Great.
Absolutely.
Thank you.
And then we also
You're
had commenters come to a city council meeting under public comment a while ago talking about one particular landlord. actively trying to drive tenants out by.
Yes, yes. Yeah.
Have you guys?
And actually, we were involved with that in Walnut Creek. It wasn't so much a fair housing issue as it was a tenant landlord issue.
Okay.
That's in speaking with the attorney, he informed me that they were still conducting negotiations on behalf of the tenants so that they wouldn't have evictions on their records. So we're still dealing with that issue.
All right, thank you. It sounded, I wasn't clear when they were talking to us whether or not it was tenant landlord or fair
Right.
housing or some nasty little soup of everything together.
Yeah, sometimes fair housing and tenant landlord overlaps, but it's when it's a tenant landlord issue, it has to do with a tenancy that's already in place and the landlord's relationship with the tenant.
Okay.
So.
All right, thank you. And now.
Speaking of.
Okay. Next up, we have the Tenant Landlord Counseling Services Program. Margie, you have 3 minutes on the clock.
Okay, thank you. Okay, ECHO is a HUD housing counseling, a HUD-approved housing counseling agency. In the tenant landlord counseling program, ECHO Housing provides counseling and dispute resolution for tenants and landlords by HUD-certified counselors and trained mediators, and any cases that require advice or consultation are referred to legal services providers. We provide information on evictions, habitability and repairs, deposits, and other rights and responsibilities. In addition, ECHO conducts presentations for owners and managers and extensive outreach to ensure that all low-income renters know about rental laws in order to best advocate for themselves and to assure that landlords are compliant with the law. In October 2019, Governor Newsom signed the Tenant Protection Act of 2019 and AB 1110. These place reasonable caps on rent increases, require that landlords have just cause to terminate tenancies of longer than 12 months, and requires landlords of single-family homes to provide them with 90 days notice of rent increase for any increase of more than 10%. These protections were designed to prevent exorbitant rent increases and homelessness. These are relatively new laws which are rendered moot, basically, with the various eviction and rent increase moratoria that came on the heels of the shelter-in-place order. Now that the eviction moratoria have expired, we are seeing a need for education and outreach to tenants and landlords who may not be aware of all these protections which were signed into law earlier due to all the confusion with the pandemic-related ordinances. We are asking for funding for counseling, mediation, and to provide legal services for advice and consultation. In 2021, 54 cases were opened, 70 counseling services were provided, 1 case was referred to small claims court, 4 cases were referred to an attorney, and 5 cases were successfully mediated in-house. And that's all I have to say on that.
Thank you.
Thank you.
Questions? No. I had a question, but I've been running through so many questions, I just lost it. What was I going to ask? Oh, I know. There was a lot of discussion about the funding that was available to property owners if their tenants were unable to pay due to COVID. And have you guys been working in that field to help the landowners understand, property owners understand how they can tack it? You know, we keep hearing that money is rolling out very slowly and not.
When we get cases, we've had cases where the tenants contacted us and they were so panicked by the fact that the landlord was proceeding with with the evictions, so that we had to talk to the tenant, find out where in line they were. We contacted the state. We worked with the landlords. And some landlords were willing to wait. Others went ahead with the eviction cases. And at that point, we can't really do anything but refer it to an attorney. Since we aren't attorneys, we would have to refer it to someone who had the legal expertise to deal with the case.
Okay, thank you.
Thank you, Margie. Next up, we have Lions Center for the Visually Impaired.
Thank you.
For their Independent Living Skills for Blind and Visually Impaired Adults program.
Good morning, everyone. This is Yolanda Braxton, and I'm the Executive Director for the Lions Center for the Visually Impaired. Thank you so much for having us and for sharing our services with the city. We've been serving them for a number of years, and our services are really for individuals who are 55 and over, and who are blind or visually impaired. And one of the services that we provide is the services for our early detection program. That's one of our service lines, where we actually go into various centers and facilities that serve senior population. And we provide vision screenings free of charge, as well as providing eyeglasses. Our eyeglass program with our VSP certificate coordinators have really been successful in providing free glasses and a free exam by an ophthalmologist for those who need it, sort of like aftercare. In addition to our EDP program, which is our early detection program, we also have our program where we do in-home services and assessments for blind and individual seniors. And these include services such as ensuring that their home is actually still compatible with their vision loss. We do in-home assessment where we offer free devices and free support and free training, orientation and mobility training for seniors who are blind and visually impaired. And our last service area is really about activities and events where we are able to increase socialization and decrease issues of isolation. And we do this by offering a number of different events and activities that seniors can engage in, that our blind and visually impaired can engage in. One of those activities took place last month at the Lindsay Wildlife excursion that we offered, where at least 15 to 20 of our clients, along with their care providers, were able to have a hands-on customized experience at the Lindsay Museum or the Lindsay experience itself. We really try to engage socially all of our clients so that they are able to, again, not isolate, but actually live a high quality of life, even though they are managing vision loss. Vision loss is increasing and does increase with the aging process, but we also have seniors who have been blind since birth. And so we have a combination of clients that we serve that really is about providing supportive services to assist them in their vision health.
Thank you. Questions?
You're welcome.
Thank you so much, and thank you for the work and the work of the Lions. I know this is a focus of the Lions across the world. So
Yes.
how many professionals does the organization employ, and how much of the work that you're doing is through volunteers?
We employ approximately 10 to 12 employees, and volunteers are, I would say, maybe we have, depending on the event itself, maybe 10 to 15 volunteers. And again, it depends on the event. Our holiday meal, for example, which was a board-led event, that took about 25 to 30 volunteers.
So you have a cadre, but you don't use them all at every week.
That is correct.
All right. Thank you.
And I don't have any questions, but I love your Zoom art behind you.
Thank you.
Okay, thank you, Yolanda.
Oh, thank you. Is that it?
Yes, that is it.
Hi. Okay. Bye.
Next up, we have Monument Crisis Center for its Critical Safety Net Resources for Families and Individuals program.
Good morning.
Hi,
morning.
Sandra. Looks like you have
I'm
Alexa
Sandra
too.
Scheer, and Executive Director of Monument Crisis Center. And I want to thank you for allowing us the opportunity to apply and also to present this morning. We are really grateful to have partnered with Walnut Creek for all these years for the benefit of our Walnut Creek residents. And we're also proud to say that of all the agencies that you're interviewing this morning, there's probably 15 on that list that are solid, constant partners with Monument Crisis Center.
Hi, everyone. My name is Alexa Gambaro. I'm the Development Director at Monument Crisis Center. I just wanted to go through some of the information on how we've served the city of Walnut Creek in the last year. So I'm looking at statistics from 2021 and wanted to mention that 100% of the people that we serve are low income, no matter what city they're from. And these are information on clients who have come to us for various services, including food distribution, resources, referrals, and health and wellness services. So in 2021, we distributed 101,460 meals to Walnut Creek residents. That was including 140 households, which meant that we fed 393 people. 50% of those households have children, and that means 30% of our Walnut Creek clients are children and 18% are seniors. And then 20% of those families are of 7 or more people. So that's showing us that we're seeing multi-generational families and everyone's kind of trying to make ends meet. We also found that families are coming to us for various services an average of 8 times in 2021. So they could be coming for food and non-food items such as diapers, pet food, toiletries, and other things that we distribute when they come in person, but they're also seeing us for our one-stop shop kind of model where our staff are able to provide them with resources and referrals to other programs in the area. And they're also able to see the community partners, like Sandra mentioned, that actually come on site here to provide information on citizenship, help with immigration, other legal aid, and assistance with education and public benefits, and then also health resources as well. And we are happy to continue doing that this year. And thank you so much for listening to us.
Thank you. Questions?
Thank you for the work that you do in the community. And it's great that the photo of your location is right behind you. So thank you, Sandra. What would you say differentiates what you do and the population that is attracted to come to your organization first, other than the other 15 partners you referenced?
That's a good question. I'll try and answer it. Alexa might have something as well to contribute. I think it's because people have this knowledge about us, this trust in us that, and most of our referrals are word of mouth. And so when someone gets helped at the center, they tell their neighbor, their friend, their sister, you know, I got help there. I think they can help you, because most often when people come into the center, they don't know who to go to for the specialties. So they don't know that, you know, Echo Housing works with the tenant, you know, issues, or they don't necessarily have a connection with Meals on Wheels, but they come into the center and they take a senior class on conditioning and exercise. They might come in for immigration resources or, you know, cancer support, whatever it is, then our staff channels them into those right partners, or it's resources that we provide on site. But it's really, you know, I've always said it's the hardest thing is to walk in the door, admit you need help. And Monument Crisis Center tries to be that welcoming place so that when they come in, they start to unload some of that burden that's on them.
Thank you. Any other questions?
No, thank you so much.
My only question is, I know we've heard a lot about inflation in groceries and the infant formula crisis and things like that. Are you guys having to increase your budgets this year, or are you just serving more pasta?
Alexa?
I think we're at a point in the last couple of years, we've noticed just delays in getting like certain staple products that we give out here. But with that being said, we've been able to accommodate just based on, you know, people being really generous and wanting to bring like in-kind donations. But like you mentioned, baby formula, we actually don't budget for that, and we only get that item as a donation. So it really just depends. But what I say is we're never gonna need less, especially if we're still seeing all of this like inflation. We're never gonna need to offer less or fewer things to our clients.
Thank you.
Yeah, and I think that the inflation thing is obviously hitting our budget, you know, as well as everybody's everyday budget. And the combination of what we're able to do, as Alexa mentioned, with grants and then in-kind donations and packing that all together to really help the client helps defray the cost, obviously, in a tremendous way. But it's hitting everything. And, you know, we felt like we were getting to a point with COVID that things were more manageable. And now with inflation just out of control, along with, you know, several other, you know, issues, yeah, I don't think our numbers are going to be going down at any point in the near future.
All right. Thank you very much.
Thank you.
Okay, next up we have Rainbow Community Center for its Kind Hearts Community Center or Community Support Program. Hi, Kristen, you're on mute. I'll put
Hi,
I'll
how's
put
it going?
3 minutes on the clock.
Okay, thank you. Thank you for having us here. I'm here with the programming team at Rainbow Community Center. We have Christopher, our older adults program manager, and Christina, our volunteer and food pantry coordinator. At Rainbow, we try to focus in serving multiple communities, specifically the LGBTQI+ community. We provide community building and wellness services, but we also try to link community members to internal and external services within our programs. We also have the opportunity to educate other providers who may not be familiar with our community, and specifically seniors and people living with HIV within the Contra Costa County. Christopher, do you want to add a little bit?
Yes, I work with seniors. LGBTQI plus seniors have specific needs as they grow older and place in the community. And we do a lot of outreach, resources and referrals to other agencies. And I don't want to take too much time, so should I pass it on to Christina?
Yes, thank you, everybody. Hello. I'd just like to add, additionally, community members rely on and actively seek out Rainbow's Kind Hearts Food Pantry because of its LGBTQIA plus approach and its stigma and shame-free environment. RCC is able to supplement their nutrition, while also reducing feelings of isolation, depression, and increasing their sense of acceptance. During recent COVID restrictions, with cross-collaboration with our Friendly Visitor Program and Senior Outreach and Advocacy Program, we are able to assess seniors' needs and facilitate a food delivery service, providing basic materials, health, medical supplies, and all other necessary items. Christopher, can you add a little more?
I could add a little bit more about the HIV prevention program. We do linkage with the Contra Costa Health Services, where we provide testing information to all community members. We also have different groups within our programming. Groups that are meant for identified men folks who are living with HIV. We also have different groups that we continue to bring different Spanish communities together in their own language. And we also welcome anybody to all of our groups. And as Christina mentioned, we're just trying to serve many people during this pandemic time when available.
Thank you, guys. Did you have any questions, Mayor Pro Tem?
No, thank you so much for the work that you do. And I love the background behind Christopher, trying to figure out where that library is.
I think he's in Hogwarts. But thank you guys for, I know you're working with a community that has not traditionally received as many benefits as others, and it's great to have a place where they can feel protected and comfortable.
Yeah, and specifically with our seniors, we've been receiving a lot of calls when it comes to connecting back to the community. Some of them are suffering with unstable housing, different living situations, and health conditions. So we just try to aim and help to help them reach the right resources when we find them.
Thank you guys. Thank you guys very much for all you do.
Thank you.
Thank you.
Thank you so much. Next up, we have Loaves and Fishes of Contra Costa County for their Nourishing Lives in Walnut Creek program.
Great, thank you.
All right. Appreciate you handling that.
And don't forget to introduce yourself when you get going.
Okay, great. Good morning. I'm Jeanette Kennedy. I'm the Development Director of Loaves and Fishes of Contra Costa. And as soon as we have that slide up, appreciate everyone's time. Okay, great. Go ahead and advance it. Thank you. The mission of Loaves and Fishes of Contra Costa is to provide community-based food programs and partner services that focus on basic needs. We nourish lives. Next slide, please. So the overview of Loaves and Fishes, we serve more than just the Walnut Creek community. We have 5 dining rooms in the county. We've began in 1983, and we've served over 5.4 million meals. And the other dining rooms besides the Walnut Creek location that is in Trinity Center is Antioch, Martinez, Pittsburgh, and Oakley. We are the only hot meal program in the county. All the meals are prepared in our central kitchen, which is in Pittsburgh, and transported into the dining rooms. We are currently still serving grab-and-go style due to the pandemic and the uncertainty of certain things. So, but that has continued to be able to serve more people than we ever have before. On a daily basis, right now, we're serving approximately 1,500 meals to people in need, and we're primarily serving very low to low-income people, families, homeless, and in doing a lot of research and working with a consultant that we got funding for, we are currently doing an expansion plan. So we have purchased a mobile unit that we will be taking food to where people are throughout the community through partners. Go ahead, extend it. So since this funding that we're talking about here today, and we're in Walnut Creek, I will focus more on the Walnut Creek location. As I know you guys know very well where the Trinity Center is, that is where our dining room is. And this dining room is our newest location of all 5. We primarily serve the homeless that come through the Trinity Center, but our dining room is open to anyone. Anyone can come in. The Trinity Center does take an intake. They ask for their self-identification of their income, and that is processed through the HMIS system. So we do have information that we can report on who is using our services, but throughout Loaves and Fishes, we are open to anyone in need. Anyone can come to the door without any requirements. And so we're serving about 650 people in Walnut Creek every year through that dining room. And it averages about 55 meals a day. And last year we served almost 20,000 meals. And the funding that we're asking for this dining room is for staffing, and it's $5,000.
Thank you, Jeanette. And it's great to finally be in the same room. And
I know, right?
little
Instead of
box
on
land.
Zoom. I know. I thought, hey, I should come down and be in the room with you all. So,
Mayor Pro Tem, do you have questions?
Thank you so much. And this is very important work that you're doing. And to think it's the only hot meal program in the county and serving all those dining rooms and the number of people. 2 questions. 650 people in Walnut Creek. If you're doing 55 a day times 5 days a week times 50 weeks, that's way more than 650. So the 650 are unique individuals?
yes, exactly. Yes.
And what is the source of your food? Because if the funding you're seeking is about staffing,
Yes.
Is this coming from the Food Bank of Contra Costa and White Pony Express?
That's a great question. So we have multiple partners for food. We do budget for food because we do have to purchase a lot of our food for the hot meal that we're serving. A lot of protein and whatever goes into that hot meal.
Okay.
But the meal that we serve is a hot entree, also a side of usually some sort of vegetable salad or something like that type, and fruit, bread, and dessert is the part of the complete meal. So we do receive donations through the food bank. We have a collaboration. We do purchase food through the food bank. White Pony Express provides us with items, and so do a lot of local grocers. But what's unique about those partnerships is those items that we get primarily are for the food pantries. And Walnut Creek is the only location that we currently don't have a food pantry for because of the capacity of Trinity Center, but all the other dining rooms have food pantries. So the food pantry is only donated food. But for the hot meal, we do have to purchase food. And so it is, some of it is donated for the hot meal, but much of it is purchased.
All right, thank you.
Of course.
Thank you, and I'm glad you recognize dessert is part of a proper.
Yes, everybody loves dessert, right?
So in the mobile unit, it sounds like that's something that's still under development. Have you thought about how you're going to use it in the community and advertise it to the target population?
So yeah, so we did, this was about 9 months of planning during COVID. We did a lot of research and identified 3 census tracts that really are in need of food and aren't able, due to a lot of different barriers, primarily transportation, able to get to us. It's Concord, Pittsburgh, and Antioch areas. We've got 2 partners currently right now. We were supposed to have the mobile unit already arrive by March. Here we are at the end of May, and we still don't have an ETA on it, unfortunately. It's being customized. It's purchased. The truck is down in Southern California, but it's being customized. So we have 2 partners. One is Delta Landing in Pittsburgh, and then the Pittsburgh Community Church All-in-One. Those 2 partners, through those 2 partners, as soon as that truck arrives, our kitchen will be able to produce the meals. So it'll be about 350 additional meals Monday through Friday that we'll be serving by transporting to those centers because they have a population that already come to them for other services that we'll be serving.
Okay. And in planning for it in the other areas, I know one of the barriers to that kind of a program can be the fact that it congregates homeless who are accessing the food, which is a good thing, but it's also community concern comes in. I was wondering how you've been dealing with that.
So right now we are going to be working with partners that have a location and bringing the food to them. And the partners, we do have MOUs, and we have a relationship of what they're responsible for, what we're responsible for to bring the food and make sure that the trash and all of the other components are considered. We did, in the planning stages, consider going through and working with CORE and going to encampments specifically to bring food to homeless. But that opened up a whole nother set of security issues and just, and then trash and a lot of other things. So we are going to work through these partners who have a population that are in need, that are coming to them to distribute the food, because that's not something they're already providing.
Okay. I was hoping you had it all figured out.
We have worked a lot. I mean, we have a wonderful strategic plan for this expansion plan. If you guys are interested, I'm happy to share it with you.
Thank you.
Of course.
Thank you very much.
Of course. So next I have the pleasure of talking about the Culinary Arts Training Program. It's just the very next slide that was in that program. Yeah, I just added it.
Okay, this is the last funding category for economic development. This is for the Loaves and Fishes Culinary Training Program.
Yes, so, thank you. Sorry, I should have told you that it had more slides there.
Okay.
Okay. Yeah, if you don't have it up, I can just talk through it. It's our Culinary Arts Training Program is a 12-week free program. So this is in conjunction with the meal program I just talked to you about. It's a win-win for everyone. We already obviously have food. They help supply food for our meal program. But it's been a wonderful thing that's been going on for several years now. It's up and running again, back for a short hiatus due to COVID. Registration is open to anyone in the community in Contra Costa. Of course, for this funding, anyone living in Walnut Creek qualifies, and we report on that. And it's really for people who have some sort of barrier to employment or interested in the culinary industry, maybe just don't, know how to take the next step. So we've put this in place, and we have a wonderful program director who's running it. And we currently have a class going. It's about 8 to 10 people usually in a class. They receive 144 hours of culinary training. Upon completion, they have their Serve Safe, which is a certificate that's required to work in any culinary job. And we also work with them with resume building and provide them with job placement through that 12-week course. So not only are they learning how to cut and, the proper temperatures and storage and just all of the things around food, but also, we want to get them a job. So we do currently have, we're really excited, this is brand new, an MOU with the Walnut Creek Marriott. So we're really excited about that. And we do currently have a class running, and we do have a Walnut Creek resident in that course, in this current course, which is wonderful. And the funding, so that we're asking again for to support our staffing, is for future courses. We do about 3 a year.
Sounds good. Questions?
So the Walnut Creek Marriott is the MOU that's needed.
We have it. We just
Great.
secured it a week or so ago. Yes. Yes, which you're right. We needed that in order, because we've had some, we haven't gone into contract, but through our proposals for previous years, there has been funding that has been awarded to do the Culinary Arts Training Program if we had the Walnut Creek residents and the Walnut Creek MOU with an employer, and we've got that now. So it's up and running. So this is for future planning that we're talking about today. But yes, we just secured.
Is that only for a year, or is that for the 3-year term of this?
That's a great question, Cindy. I will have to look. Our program director, she hasn't shared the. I don't know if it has a term limit on it, to be honest. So I will make sure that is through the 3 years.
At least that we have the answer. If it's not for the full 3 years, then we'll be asking the same question next year.
Yes, understood.
Great, thank you.
All right, thank you. Thank you very much for coming in today.
Thank you, guys. Have a great day.
Thank you,
Thank
Jeanette.
you. Thank you.
Okay, the last presentation that we have, our applicant presentation, is for Contra Costa Child Care Council for Cocoa Kids, Inc. Road to Success program.
And it looks like we have 3 representatives coming in.
Hi there. Can I share screen?
Is it for a presentation?
Yes.
Yes, we can accommodate the request. We will promote you as a host.
Okay, thank you so much. There we go. Okay.
Okay.
Hi, everyone. My name is Emily Young, and I am the Workforce Development Coordinator for Cocoa Kids. And I'm joined here today with Julia, who is our Resource and Referral Special Projects Coordinator, and Candida Dubois, who is our Resource and Referral Program Manager. And we're here today to talk about the Road to Success program. So our mission as an organization is to champion and advance quality childcare and early education. And the way that we're able to do this is through your support in helping us support childcare providers in Walnut Creek and other cities as well. So childcare has been kind of in the forefront of the news lately. Childcare providers as an industry are really struggling to make ends meet. They've been stretched thin with their dollars and their time. And it's been really difficult for a lot of childcare providers, and we're seeing them leaving in droves. The outlook of childcare in Walnut Creek since COVID-19, since March of 2020, out of 45 centers in Walnut Creek, 9 of them have closed or are temporarily inactive. So that's close to 20%. Out of 41 family childcare providers in Walnut Creek, 9 have closed, which means 22% of them have either closed or they're temporarily inactive. The participants that are a part of this program or have been a part of this program for the past few years, only 2 of them have closed. So that's only 16%. So this program really does provide a lot of support for childcare providers, and we're able to sustain them. One of those, we did have one additional that she didn't close, but she did move to a different county. But she did reach out when she informed us that she was closing, that she felt very supported by Cocoa Kids and was appreciative for what we were able to offer to them. So why does family childcare matter? Because this program does specifically support family childcare as opposed to centers. Out of 35 centers in Walnut Creek, none of them offer evening or overnight care, and only 5 offer a rotating schedule, which you can think of like nurses and doctors who might have a 3 on, 4 off schedule or 4 on, 4 off schedule. And only 6 of them offer drop-in care. Drop-in care is when a parent might need to utilize care for a short amount of time, maybe a day or 2 or a week, because their original childcare provider is closed for any number of reasons. Out of 31 family childcare, 2 offer evening care and 1 offers overnight care, which really helps families in the area who are working non-traditional schedules. 3 are offering rotating schedule, and 14 offer drop-in care. So they're really flexible and providing a need to families in the city of Walnut Creek. We're still working with providers and recruiting them to become family child care providers. Right now, we have 1 that is pending licensure, and we have 1 that just became licensed. And we're working with 3 others who are going through the application process. So we are actively looking for people to join and become family child care providers.
And I think we're just about wrapping up our time here.
Oh, okay. Let me just share. We have 3 family child care providers who are not working, are inactive, not caring for children right now. Many have taken a step back due to COVID-19. We do have 1 that is actually actively going for her master's degree in early childhood education. Julie, if you don't mind, I'll just take over this one real quick so we don't have to do a switcheroo. But
actually, we kind of need to wrap it up. Sorry.
Okay. All right. Thanks.
Thanks. Mayor Pro Tem, did you have questions?
So what is the biggest barrier to encouraging people to join this occupation? And my daughter was in a family daycare situation, not a daycare center. So I really understand the value of it. But what's the biggest barrier today?
when you're asking the biggest, hi, my name is Candido Dupewa, I'm the R&R program manager. And Councilman member Cindy Silva, I think your name is, you're asking the biggest barrier for access for families or the biggest barrier to open the business?
To open the business, because that's what you're trying to do, is create the business that will then in turn support the families of our community.
Well, right now, due to COVID, it has been a barrier with protections. And so a lot of our providers are only taking one family in because of they're still worried about, getting COVID, right? They're worried about their health a lot of times. The biggest barrier too is other things besides that, as far as filling out the application that we help them with. We help them with building a business plan. We help them with the curriculum piece and cognitive learning, and setting up their environment so it's inclusive to all children. And it can be time consuming and not understanding the business background in childcare. And that's why we're here to help them do that. And we're a hands-on approach. We have been doing this for over 40 years, and encouraging them. And right now in advocacy, if you look at it, childcare is on the forefront, like Emily was talking about, and that families need access, and our supply we've lost supply by 20 to 25%. And so we're trying to build back the supply so families have options to choose from.
So thank you.
If you don't mind, I'll add to that.
Actually, we're on a time crunch, so
okay.
that was a great answer to the question.
Okay.
Thank you, guys. I don't have any questions, but you guys helped my kids find a caregiver, and they are in their 20s, and they still send Christmas cards back and forth to her. So thank you for all you do.
Thank you for having us. We appreciate it.
Okay, next up is staff's presentation. If Meredith can help me share my screen. Good morning again, Mayor Pro Tem Silva and Councilmember Darling. For the record, my name is Shaluna Vian, Affordable Housing and Grants Coordinator. Before I start my presentation, I want to thank both of you for being here today and listening to the 26 applications who just went before me, making my presentation the 27th one that you're listening to today. Today, I'll be presenting on the fiscal year 2020-2023 funding recommendations for our community grants program. The city's community grant program consists of 4 different funding sources: the Federal Community Development Block Grant Program, CDBG, the Local Community Services Grant, CSG, the Local Homeless Services Grant, HSG, and the State Permanent Local Housing Allocation, PLHA. Activities recommended for funding primarily benefit low and moderate income persons up to 80% of the area median income. The community grant program operates on an alternating 2- and 3-year funding cycle. Fiscal year 2022-2023 is the first year in the upcoming 3-year funding cycle. Funding recommendations are based on the program's ability to meet the CDBG Consolidated Plan High Priority Need, which was approved by Council in 2020 and also listed on this slide. Programs recommended in the first year will also receive funding in the second and third year of the funding cycle, though amounts will be contingent on funds available and program performance. In the renewal years, staff will return to the HCD Committee and City Council to confirm the funding amounts for the grant subrecipients. The City of Walnut Creek is an entitlement community for CDBG funds. As long as our program is in good standing, we will receive an annual allocation each year. Activities funded must meet a CDBG national objective with at least 70% of the funds, not including program admin, serving low and moderate income persons. Additionally, there are caps on the maximum percentage of the CDBG grant that can be spent in certain categories. 20% of the current year's allocation plus 20% of the current year's program income can be used for program admin. 15% of the current year's allocation plus 15% of the previous year's program income can be used for public services. Typically, we get the most applicants for this category, so it is competitive where activities funded should meet our highest priority needs. And then the rest of the funds, about 65%, can then go towards economic development, housing, public facility, or infrastructure projects. Since the CDBG program limits the public services cap to 15%, and because there is a need for public services, the City Council created the CSG program to augment the public services portion. The Homeless Services Grant, HSG, was created in 2017 specifically to address homelessness and the prevention of homelessness in Walnut Creek. The program was initially budgeted at $200,000 each fiscal year, but was reduced to $70,000 in fiscal year 2020 due to the economic impacts of the COVID-19 pandemic. The funding reduction was offset by a state grant program called the Permanent Local Housing Allocation, PLHA. In 2020, Walnut Creek applied for PLHA, a 5-year non-competitive state grant. The funding source is from recording fees and can be used to address the stock of affordable housing, as well as address homelessness. The PLHA funds can be used to continue existing services, which is how it replaced 65% of the HSG funds. This slide here is a chart of the available funding across all the 4 programs. For the CDBG program, we're estimating approximately $422,000. Between CSG and HSG, approximately $170,000. And lastly, PLHA, $159,000. Which can increase or decrease once the 3rd-year allocations are out. And then across all these 4 funding buckets, about $751,000. So for the upcoming grant cycle, we received 26 applications, and each applicant had the opportunity to present at today's meeting. Majority of the applications are requesting for funds under the public services category, and as shown here on this chart, exceeds the maximum available in that category of about $190,000. Funding recommendations. Under the CDBG admin cap, staff is recommending to allocate the maximum percentage allowed in this category. Admin funds can be used to pay for personnel costs as well as a fair housing program. In fiscal year 21-22, the city funded Echo Housing under the admin cap, but staff is recommending that we fund it under the public services cap, so it's more of just a swap-in category. For the public services category, staff is recommending, first to start off, not funding Choice in Aging and Cancer Support Community. So the nonprofit organizations, Choice in Aging and Cancer Support Community, were new applicants in the 2-year funding cycle. And the CDBG funds, they do require that these programs serve at least 51% or more of a low and moderate income population. So in the first year, cancer support served 17% of a LMI population and 29% so far. So for this reason, staff does not recommend funding Cancer Support Community. Additionally, staff does not recommend funding Choice in Aging because throughout the current funding cycle, they have consistently missed their deadline to submit quarterly progress and financial reports to the city. In addition, they submitted their application a day late after the application deadline to Walnut Creek, Concord, and the county. And then the county actually have decided not to accept their late application. Okay, 2, staff recommends funding the remaining grant applicants at the same funding level as fiscal year 21-22, plus an increase of 18% or at the requested amount, whichever is less. And staff also recommends funding an organization new to the city's community grants program, the Contra Costa Family Justice Alliance, at the requested amount of $5,000. This program provides navigation services to victims of domestic violence, sexual assault, child abuse, elder abuse, and human trafficking. For the categories listed on this slide, there is no funding cap. Staff does recommend funding all applicants. apologies, under the economic development category, including Loaves and Fishes culinary training program. And as you just heard, they secured their MOU, which is a requirement to be eligible under this category. And for the housing and public facility category, staff recommends funding the city's home rehab program, administered by Habitat for Humanity at $120,000. And then for the rest of the available CDBG funds, staff is recommending it to Meals on Wheels, energy, safety, and health improvements to the office project. The request was at $156,000, but with the limited remaining CDBG funds, staff is recommending $139,000. And if the city does receive more program income or carry forward funds, it is in the backup funding scenario where we can increase it up to the requested amount. Under, excuse me, the homeless services grant applications, we are recommending it to fund at the requested amount or at the same fiscal year 21-22 funding level, plus an 18% increase, whichever is less. The exception is for the core county-wide team that provides nights and weekend services in Walnut Creek. Staff is recommending $15,000, which is a decrease of approximately $6,000 from the previous years. And staff is recommending a lesser amount since the proposed number of served clients is 4% of the total population served countywide, while in years past, the city funded 12% of the budget. This funding recommendation at $15,000 will fund 8% of the budget, as opposed to 12% previously. The City Council approved funding a full-time core team in fiscal year 22-23. The program cost is approximately $250,000, an increase of 1% from the previous year. Staff is recommending the funding plan as shown on this slide for a full-time team. In fiscal year 23, 24 and beyond, the City Council will need to decide to either discontinue the program, find a new partner, or fund a full-time team. In 2021, the city submitted to the State Department of Housing and Community Development a PLHA 5-year substantial amendment plan. The city received word that the amendment plan has been approved, but the city has not received this PLHA standard agreement yet. Of the anticipated $159,000, staff recommends allocating the PLHA funds in the same manner as stated in the amendment and as seen on this slide. And up to 10% of the funding can be reallocated without a plan amendment. So staff is recommending that the HCD committee provide input on the proposed fiscal year 22-23 funding recommendations and backup funding scenario for CDBG, CSG, HSG, and PLHA program as outlined in attachments 2, 3, 4, and 5. And recommend that the City Council adopt the proposed funding plan for the CDBG program as part of the annual action plan, which will go to City Council on June 21st for review and approval. And with that said, I'd be happy to answer any questions that you have.
Thank you, and for the tour of alphabet soup. Mayor Pro Tem.
I have some questions, and I think then we are scheduled for a break. My questions may result in some calculation work over lunch.
Okay.
And I'm looking at attachment 2, which is the very tiny spreadsheet, which I should have brought on my magnifying glass. But I appreciate all of the work in this. So I'm going to start with, are we sure this adds up correctly? Because if it doesn't, something may not work. The first line, which is Contra Costa Family Justice Alliance, I see it's recommended in the CDBG category, but it never carries out to the far right column. So are we sure the total number doesn't carry to there? And so are we sure that that number down here is that the total public services categories are adding?
There's a reason she's on this committee.
Let's
Sure, we can also
I think
project
just
it
checking the
onto
spreadsheet
screen. Okay.
at lunch
w-
would be great.
Was it for the Family Justice
Yes, the
Alliance?
family justice. And then when you go down to, and these are the only first two that caught my eye, so this, am concerned that everything must properly foot, as the accountants would say. If you go to the second core services, the county-wide, it says CDBG $10,080, right?
Correct.
And $5,000 from, the $80 is missing in the far right column. It's 15,000. So something's not adding up correctly.
Yes, it looks like that.
So-
And we can either adjust it during the funding deliberation.
Right, if we can just check it all, because if we're going to deliberate and we might ask, where could we find a little more money?
Sure, yeah.
We're not sure if we're still, if that little more money might be a little more than a little more. That
Correct. We can
completely
adjust
didn't make sense. The rules for CDBG, can you remind me, what are the requirements? Cancer Support Community is not eligible for CDBG because they're not LMI.
They're not serving a majority of LMI, which
LMI.
is 51% or more.
We've funded Cancer Support Community more than once in the past, because I can actually remember who was pitching it when I was sitting here. So is there a constraint in the community services
Yeah,
category?
so
Do we have constraints in our community services funds in the same way that CDBG, which are federal funds, have
So-
those constraints?
Yeah, great question. There is flexibility with the CSG program, but when looking at the resolution, it specifically said that it is to supplement the 15% public services cap. So we imagine that they would have to qualify under CDBG, and then to go above that 50% cap, they would also have to qualify in the CSG category also.
And the resolution you're referring to is when we establish the funding every budget cycle, or when we establish this every time?
When we established the CSG program initially.
And that was how long ago?
Oh gosh, I can't remember off the top of my head.
Probably at least 20 years ago. Same question about the housing.
Homeless services. Correct?
Homeless services funding, because we only established that. I mean, I was here and on the committee that actually recommended us establishing that. This number has dropped significantly because the PLHA funding from the state became available. Is there a resolution that restricts us to 77,000 and change, or is that something, by the way, resolutions can be changed at any point in time. It's not like it's in the Muni Code. But are we able to increase that number and do it through the approval cycle with the council?
Yes, I think you can propose to increase that $70,000 amount.
We'd have to find a source of funds for that.
Correct, yeah.
Okay. And I think the rest of it is more debate between us. Okay, so if during our lunch break, someone can check the spreadsheet, so we know if we have any technical, if we have to find a little more money in some pot. Thank you.
Thank you.
My only question was, there was a couple discussion points about what would we do with extra funding if it came in? And it seemed like those uniformly were saying additional staff, program administration costs. Are we fully covering our administration costs on these programs, or are we shorting ourselves?
I would say that we are covering it fully, and some years we actually find it hard to expend the full program admin cap, also because it's tied to the program income, which could be unpredictable. So just recently we received some in our admin cap increased by $6,000. So yeah, we actually are sometimes having trouble reaching and spending the admin cap.
So if we do receive additional money, even though admin shows up as the first priority, it could quickly default to the second and third priorities.
Correct, yes.
Okay. And so
that's more of the minimum that we can allocate towards, and then we can technically allocate that elsewhere to a different project if we wanted to.
Okay, so when we come back, the big question marks are Family Justice Navigation Project, Choice in Aging, the core team and the countywide core team, cancer support, Meals on Wheels, and then HSG. Is there anything else that you could, I mean, I'm just thinking about.
Yeah, I would say you touched on the ones that
Okay.
we will be primarily focusing on.
All right. Well, I really appreciate you guys getting us through this morning on time and on track. And, oh, that's right, public comment. Do we have any, now's the time for public comment. I knew Meredith was here for a reason. If any of the attendees on Zoom would like to, please raise your hand. Anyone? Nope. All right, and with that, we will adjourn for lunch and come back at 1 o'clock to complete this. Thank you, guys. Okay, and we're back to the Housing and Community Development Council Committee special meeting, and we are going to be talking about, we have closed public comment, we have heard from all the applicants, and so now we are going to be discussing what our recommendation is going to be to the council. And I think there was a question for you, Sharluna, at the beginning about the spreadsheet.
Correct. So if I may, I will share the spreadsheet. If I can, I will go ahead and share the funding recommendation spreadsheet. So the first question that Mayor Pro Tem Silva had was whether the $5,000 recommended funding for a family justice navigation program carried over. And it wasn't filled here, but actually the summation of it came from over here. So it did pull down.
Okay,
from
good.
it. And I didn't follow the second question, if you can clarify that.
Actually, it was the second core services.
Okay.
And the second one more row down. That previously said 10,080, and now it appears that it only says 10,000. Of course, it could have been a bad mark on my paper, so when I printed. So, okay.
So they're
So everything is now clear.
Okay.
Correct. Is that?
Was that your
I think this makes sense now, so I think we're ready to go forward.
Okay.
So why don't we start ticking down from the top, just to check in with each other on a few of these things. So I am the Contra Costa Family Justice Alliance as our new grant recipient. I'm comfortable with that.
I think that's good. I'm comfortable with all of those in that crisis intervention services category.
Yeah, I think those are, and everybody's getting a decent amount there. The next chunk down in senior services. Did you want to talk about anything in senior services?
I want to have a discussion on choice and aging, but the others I think are okay.
Yeah, I think everything else is okay, but I too would like to talk about choice and aging.
Right.
Do you want to start?
Well, maybe we could do as much as we can, and then
Okay, we'll come back to
figure
that
out
one.
which ones we need to talk about.
Okay, and then we get down to the homeless services. Here,
I would like to talk about Trinity Center operating.
yeah, that was the one that I was going to talk about. Everything else on that one looked good to me.
Me too.
Yeah. Okay, and then other social services. Here, I didn't have anything that I needed to talk about there.
Neither did I.
Okay, and then economic development looked good to me.
Same here.
Same here, and then I did want to touch bases real quick on the Meals on Wheels
I would like
HVAC.
I would like to as well.
Okay. All right, so let's go back, and looks like we have 3 points to talk about. So let's start with choice and aging.
I am struggling with the value of what they deliver and the inability during COVID to, and actually answer a question for me, where the last funding cycle was only 2 years, was that the 2 years that the first time and only time they had? So I'm struggling to say that we should be just saying no, because they delivered, they had to pivot significantly. They were doing things that they picked up the slack where no one else could, moving into the community. And while I wouldn't be willing to increase their funding at 3 times the level, I want to talk with you,
Yeah.
Cindy Darling, council member, about whether there is some funding level, and I know we don't have the money yet, but that's our job, is to find it. And how do you feel about it?
Yeah, I looked at this one. Choice in Aging is one of the nonprofits that deals with the sector most impacted by COVID. And I know that they reached out and did a lot for the senior community with distribution of PPE to senior care facilities, mobile clinics for vaccination. They did a bunch of things kind of above and beyond, which I am more willing to cut them a little bit of slack. Not a lot, but, you know, give them a second chance.
Well, I would be like, if you can't get your reports in on time, next year, the number is 0.
Yeah.
For subsequent years, if we're allowed to do that and even stipulate it in the resolution.
Yeah, so for the renewal years, staff will come back to the HCD committee and city council to confirm the grant subrecipient funding amount.
Mhm.
So if they aren't performing in the first year, then in the second year, we can choose to fund them or not.
And I would want to make sure that that's very clear to them if we can find money to fund them this year, that the expectation is that everything, that we have moved beyond crisis mode and we're back into normal times. And that means as a grant recipient, they have to comply with timing and schedule. And then the question is.
So I pulled Trinity Center operating.
Okay.
So when I look at all of the organizations that we're helping to provide funds to, the one that is based in Walnut Creek and its primary focus of its work is in Walnut Creek is Trinity Center. And I think their operating costs have risen. I think there's a need, and I think we should talk about perhaps increasing it a little more. And I know it doesn't meet the formula approach, but they are more here than any of the other entities. I mean, we are the focus of their work, and it not only helps those members of our community, but also the community at large that needs us digging in to help address and mitigate the homeless situation in our community. Your thoughts?
Yeah, and I am interested in making sure they have enough to operate. I've been following their reported number of clients each month and then the point in time count from February, and we are seeing an uptick in homelessness in the community. And I know it's something from talking to members of the community that there is a strong desire to make sure that people that are here that are homeless have services. And I recognize that there's a lot of the other grant applicants that are helping that safety net to keep people from falling into homelessness, but I look at Trinity Center as the last basket to catch people. And so
and the first stop when they are homeless in Walnut Creek.
And the more we can help people at the point that they enter into homelessness and get them back on, the better off we are. So I would be interested in increasing their operating in also. And then the last one for me is Meals on Wheels. I struggle with this one. It's a capital project that's necessary, and I'm worried that if we don't fund the whole capital project, they may not be able to complete the project.
I would agree with you, but I'm also concerned that we really don't have good numbers yet.
That's true.
We have one bid. I'm not sure how good it is. It hasn't been double or triple vetted. And from experience, prior to when you were on council, we had another nonprofit that we owned the building for, and HVAC system became an issue. And it turned out, because it was our building, when Public Works assessed and evaluated it, it was a lot more expensive than what somebody thought. And so I don't know how you do that.
Yeah, so
To not violate the requirement of having made this decision by X is maybe a placeholder number.
I would say it is more of a placeholder number. I do anticipate that we will get more carry forward funds or program income. So in the backup funding scenario, I will say like 90%, 95% that we most likely will fund them the full amount. It's just right now, based off of the available funding sources we have, we can't, but we can, based off the backup funding scenario, increase it once we receive more funds.
So if we agree with the funding level that's here today, but tell them, go firm up your numbers, and those numbers come back in, at that point, we can look at our other, the funding that's coming back into the program and the other funding sources.
Yes, exactly.
And make a more informed decision about that one.
Up to the amount that they requested.
Up to the 156,
Correct, yes.
55. Okay. So now back to Choice and Aging and Trinity.
So Choice and Aging this year was this funding cycle was at 7832. If I'm reading the right page in the right place.
Yes, that is what I'm reading.
What if we did this? Everyone else who has an existing number was plus 18%.
Yes, or at the requested amount, whichever is less.
And what would you think of just saying 7832? You get the same number again for 1 year. You're on notice, but don't. What do you think? As opposed to giving them 7832 plus 18%, at least
I think that makes sense. You say, we're going to fund you at the same level as last year. You're on notice that these requirements need to be met on a timely basis.
So if we did that.
Okay.
We're just playing around with math right now. Where we're going to find the money?
That's the next question. And then the Trinity operating, they asked for 20. They're recommended to get 11.8.
Is it 11.8 or 11.580?
It's 11.8 on mine.
Okay, wait.
I have adjusted my glasses because I went to the Lions and they fixed me.
11.8, okay. What if it was 15? What if it was 15? That'd be another 3,200.
And that would put we need to figure out where roughly 11,000 comes from.
And I was going to suggest on the Meals on Wheels, the HVAC, that we make the number 140,000, because that looks more like a placeholder than 130,290.
Let me just double check.
Yeah, and include the notes there that.
Which would be another 700 and.
So it looks like we have about $51 left unallocated for CDBG. So if you wanted to round up the Meals on Wheels public facilities improvement, then we can change it to 140,000.
Okay.
Just
hang tight.
It's
for now.
A broadside of a barn, as the old phrase goes.
Yeah.
Hopefully it's less than and not more than. So, Councilmember Darling, where are we going to find this money?
Well, there's a couple choices. As a member of the Finance Committee, you should,
Well, I've been there before.
Yeah. Let me check with staff on this. If CSG and HSG are basically city general fund.
Correct.
And if we
could ask the council to fund an additional $12,000 in rough numbers for the CSG, because I think all of the three that we're talking about are CSG eligible.
Yeah.
Yes?
Does that make sense?
Yes, yes.
Okay. Okay, so if we,
Or we could reduce our take on administration by $11,000 to $12,000. Maybe staff would like to weigh in on which option it would be the easiest to deal with.
Yeah, I would say I would leave the program administration amount as is. I feel like it gets harder for us to spend the amount fully down if it's above $90,000, which is what's happening this current year. But right now it stands at, it's at 77,000.
and so at 77,000, the expenses that we're charging to it make sense.
Yeah, I would say that would make sense. But anything above 90,000, that's when we do have more flexibility.
So how important is it that we identify the extra roughly 12,000? Do you have any magic pockets?
So what's not included on here, as Mayor Pro Tem Silva noticed, was about that $77,000. So with HSG, we're allowed to do 10% carry forward funds if those funds are unallocated. So I didn't include it in here just in case that didn't happen, but we could say that if we got more carry forward funds for HSG up to $7,000, that we can allocate it to certain programs.
But when will we know that?
We will know it by the end of the fiscal year, so June 30th.
Problem is we have to make a decision and have the conversation about, I don't like these backup plans because that means, oh, we'll fund them if.
Yeah.
It becomes very confusing for council.
Okay, so one way to go about this is to say this 12,000 is going to come either out of the general fund or ARPA money, and then indicate that if the backup fund, if the carry forward funds are available, that they could be used to replace that. How does that sound?
I think we could write that recommendation that we firmly, I don't know, I'm making this up, we want this done, and these are the three funding sources that it'll come from A, if there's more carry forward, it comes from there. If there's not enough carry forward, the general fund will cover it, and that could be from ARPA, because everything passes through the general fund
That's
on
true.
its way too. But
are we being as clear as mud?
So you suggested 12,000, right? So HSG would be 7,000, potentially 7,000. So are we recommending another $5,000 for an increase for the CSG funds?
7832 for Choice and Aging, 3,200 for Trinity Center, and it takes $710 to round up to 140,000, unless you found that $710 someplace else.
So, and what was the last one, Mayor Pro Tem Silva?
So $7,832 for Choice and Aging.
Okay.
3,200 additional dollars
For Trinity.
for
Okay.
Trinity Center, and $710 on the HVAC placeholder number for Meals on Wheels.
Yeah. So for the $710, let's see how much we have in. Okay, we only have $50, so it would be $710 minus $50. So a request of 11,000, unless you want to, of course, round up to 12,000.
Yeah, I was just doing round numbers. They're
Okay.
easier to process in everybody's head. But if you like them to be precise. So you're saying that would actually be $660, which brings it down to 11,692.
Correct, that's the number I'm also getting.
That's the precise number.
And 0 cents. So why don't we present it as 12,000 rather than 11, just so that way,
Yeah.
saying, using the carry forward, if we don't use the carry forward, then we use 12,000 from general fund out of other.
Which could be funded from basically unfunded reserve or undesignated reserve, so budget surplus from this fiscal year or from ARPA.
Yeah.
Okay.
And that I keep looking over to the other side of the room because there are more members of Community Development Department here. Oh, I see a thumbs up from the head. We're going rogue here.
And do you feel good about having enough justification that you could work into the staff presentation on this one? I think what we're talking about for Choice in Aging is they're serving a community most impacted by COVID, did a lot of things above and beyond, clearly have an understanding that their lack of adherence to administrative requirements is something that they should not repeat based on their presentation today, and so that's why.
Because of their good performance, we're going to keep their good services they're providing, we're going to keep them, but we're only keeping them at the level that they had in this past year and not giving any increase at all.
Yeah.
Okay.
And then on Trinity,
You're recommending $15,000 for Trinity Center.
Yeah.
So a difference of 3,200. And then for the Meals on Wheels, energy safety and health improvements, you want to round it up to $140,000. Is that correct?
Yeah, and with the recognition that that is a placeholder number, they need to sharpen their pencils and get the bids on that.
Got it. Okay. Okay. I think
Do you need a motion from us on this?
I think so, yes. Right, Andy?
All right. I move to recommend to the City Council the funding recommendations as presented in attachment 2 of the, what's today's date? May 19th, 2022 special meeting of the Housing and Community Development Committee with the following additions: adding $7,832 grant recommendation out of the Community Services Grant Fund for Choice in Aging, increasing the Trinity Center operating costs from the Community Services Grant from $9,057 to $12,257, and increasing the Meals on Wheels Diablo Regional HVAC system infrastructure project to $140,000. In addition, the committee is recommending that the grant to Choice in Aging be clearly presented to them with the stipulation that this is the last opportunity. They must deliver the required reports in the coming year. And to Meals on Wheels, that the $140,000 is the placeholder so that they can secure competitive bids, period.
And then adding into there that the funding for these recommendations comes from carryover first, and if not carryover, then
The general fund.
General fund.
Okay.
And with that,
Into the Community Services Grant Fund.
into Community Service Grant Fund. And with that, I will second that. All in favor, say aye.
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 Okay.
And you'll have to re-listen to the tape probably just to.
That was completely fine.
But it's not 2 in the morning, so we're not, we're relatively fresh. And I think that concludes our meeting here today. Is there anything else that we need to do for the good of the order?
When is this set to come to council?
June 21st.
Okay, so 2 meetings.
All right. Thank you guys so much for, this is a tremendous bunch of information, and I really appreciated the work that staff did to put it all in order and to get it all to make sense, and then to even print it out big enough so that we could see it. I really appreciate everything you guys have done today. And with that, we are adjourned.
Thank you.